Wow. But why don't we just start early? Are you ready? Okay. Good morning. Good morning, everybody. Please come on in, take your seats, have a seat. I am so excited to be with all of you today for today's 2023 Hot Issues in Health Conference. I am Sarah Schmidt. I'm the president and CEO of the Colorado Health Institute. Thank you. We have over 200 people who are here in this room today, and we have just as many, if not more, who are joining us virtually from across the state. And could we do a quick change of the screen to say hello to our virtual participants? Can we do that? Oh, look at all these people. Anyone want to come off their camera and wave hello to the stage? A little wave? They're like, no. We're taking the conference from the bedroom, from the bed today. Fair enough. Great. Thank you, everybody. So however you are joining us today, whether you are here in this room or joining us virtually, you are all welcome at Hot Issues in Health. It is a time every year when we come together to make new connections, to challenge the things that we think, the ideas that we have, and to find new partners who help us advance the work that we all do together to address health and health equity in Colorado. And we have so much good stuff in store for you today. We've got renowned speakers who will be coming up on this stage, leading us through some interesting and provocative conversation around artificial intelligence. We will have young people coming up here telling us what they think about social media and the impact that it has in their lives. And there's a lot more. If you've got a program, please reference that because that will give you everything you need. All right. Thanks very much to sponsorship from the Rocky Mountain Health Plans, a United Healthcare company, and the Colorado Health Foundation. All of our content today on the stage will be translated by Community Language Cooperative. So I would like to invite Danielle up to the stage to tell us how that is going to work.
Good morning.
It might take a minute.
Good morning. Buenos días. I'm Daniela Short with the Community Language Cooperative. Soy Daniela Short con el Community Language Cooperative. Y estoy aquí para ofrecer interpretación simultánea en inglés y español. I'm here with my coworker, Suli, to provide simultaneous interpretation between English and Spanish. And so you may hear a little murmur in the back of the room sometimes. We are doing our job, and we'll try to keep it quiet. Si escuchan ruido aquí al fondo del salón es porque estamos trabajando. A couple of things that will help this move smoothly, and of course all of this is so that we can provide a space that is really respecting the principles of language justice, where everyone can listen and participate and speak in the language of their heart. Entonces todo esto es para poder ofrecer un espacio de justicia del lenguaje donde todos puedan participar, escuchar y hablar en el lenguaje de su corazón. So a couple of things. When there is participation in the sessions, we please ask that you speak up. We need to be able to hear you over the sound of our voices. Also speak at a nice conversational pace because it takes about 20% longer to say everything in Spanish that you say in English. And we also ask that you speak one person at a time, so that we don't have to choose who that we are interpreting for. Entonces pedimos, cuando hay participación en los salones, que hablen una persona a la vez para que no tengamos que escoger para quién interpretar, que hablen en voz alta para que escuchemos bien, y también que hablen a un ritmo conversacional para que podamos quedar a tanto. Si hay problemas con el equipo, por favor avísenos. A veces hay que volver a apagar y volver a prender el equipo. Just letting folks know if there's any trouble with the equipment, let us know. Sometimes we just need to turn it off and turn it back on. And if any questions, any issues, please just let us know. Thank you so much.
Thank you, Danielle. Okay. I also want to acknowledge on behalf of the Colorado Health Institute that the land on which we are gathering today for our conference is the traditional territory of the Arapaho, the Cheyenne, and the Ute peoples, who are still with us today. And we also acknowledge that there are 48 historical tribes that are connected with Colorado from across the state. And many of our virtual participants are on those lands as well, too. We commit to working on policies and programs that address past and current inequities and improve health. Now, I would like to invite CHI board member K. Ramachandran to the stage.
So I came up with Brandon not because I dressed from the shoes up, but because I have a new hip. Is this working, Sarah?
Let's bring it in a little closer.
Can you hear me now? Yes. Perfect. Good morning. I'm K. Ramachandran, and I serve on the Board of Trustees of CHI. And on behalf of the Board of Trustees, I want to thank each and every one of you who are here in person or virtual with us. In my other life, I'm the CEO of Marillac Health, the federally qualified health center for Mesa County. And along with another board member on the Board of Trustees, we too represent the Western Slope on the board. When Michelle Leek, the former CEO, approached me a long time ago to serve as a board member on the Board of Trustees, I had absolutely no hesitation. I have always admired and continue to admire, even today, CHI's statewide focus, its commitment to rural health, and also to healthcare access. The last 3 years have been unprecedented in every industry, most in healthcare. Even those of us who'd worked for very long in healthcare, everything we did was challenged. We had to be nimble, creative, courageous, fearless. We did things like stand up telehealth in 5 days, use aging buildings where the entrance couldn't be the exit anymore, use narrow corridors to keep our patients safe 6 feet apart from each other, motivate our workforce, but more than ever to motivate and keep our patients safe. And nothing says it all better than bringing people under one roof like a forum like this to talk about common challenges and also to talk about creative solutions. I would encourage each of you, participants in the conference today, reach out to people you don't know. There could be an opportunity in the making or a partnership forging. I would like to recognize a few people in the room, members of the Board of Trustees of CHI, if you could please stand up. Thank you for your service, and it's a great privilege to serve alongside you. Staff of CHI, who with very little fuss and noise put this excellent conference together. Could you please stand up? And if we have any elected officials, we would like to recognize you too. Enjoy the conference. I'll pass it on to Sarah. Thanks, Sarah.
Thank you. Thank you, Kay. All right. I am now excited to welcome Patrick Gordon, the president and CEO of Rocky Mountain Health Plans, a United Healthcare company, up to the stage. Rocky is our health equity champion sponsor and is supporting all of the translation and the equitable access that is happening for the conference today. So thank you, Patrick.
Thanks, everybody. Good morning. It's great to be here. Like Kay, I have been a longtime fan of CHI. I have always appreciated their work, the intellectual honesty they bring in their analysis, and that's really critical at times like this in a state like ours, which is full of challenges, but also full of opportunity. Rocky Mountain Health Plans, many of you know our organization. We've been on the Colorado scene for about 50 years. And our mission has long been aligned with the themes we're talking about today, because the themes we're talking about today are decades-old problems. Back in the day, communities like the Western Slope were confronting issues of access and quality and equity. We didn't call it health equity back then, but the reality is that we knew as we all do now, that there really cannot be health without community, And there can't be community unless there's an intentional effort to include everybody. So again, as we talk today and work through the discussion, we're tremendously proud to be a part of solutions that are emerging in Colorado to close the ongoing disparities we confront. But this is an exciting time. We have a tremendous opportunity to expand coverage. I want to give a shout out for everyone who worked on the OmniSalud program. Okay, so OmniSalud was new last year. In a matter of days, the available slots filled up. This year, for 2024 coverage, 11,000 slots went in less than 30 hours. So that really underscores the need, and that underscores the importance of making sure we sustain programs like OmniSalud with sound financing and policy decisions. But that's a major step forward, and I'm very proud to be a part of Colorado when we look at programs like that. I'm also incredibly excited about the opportunity to accelerate behavioral health integration in the state, clinical integration, payment reform. All of these topics, all of these buzzwords are means to an end, not the end itself. But the end itself is a much more inclusive, equitable, and affordable health system. And CHI has always been, a tip of the spear in that work and in that mission. So anyway, without further ado, thank you, Sarah. Thanks, everybody. And let's enjoy the day. Thank you.
And thank you to Rocky again for their sponsorship. It takes a village to make this conference happen, and I just want to thank and acknowledge our other sponsors for today in addition to Rocky. The Colorado Health Foundation, I've already mentioned, is not only supporting accessible options for online participation, they're also our lunch sponsor. If you've never had lunch here in the hotel, you will not want to miss it. It's very delicious. Speaking of things you don't want to miss our reception immediately following the conference just on the other side, and that is being sponsored thanks to the Colorado Hospital Association, Partners for Children's Mental Health, and Trailhead Institute. We will be well fueled for our networking breaks thanks to support from Colorado Access. We'll have snack stations out during the 2 breaks that we have during the day. Let's see, we have several participants here thanks to generous scholarship support from Craig Hospital, the Colorado Community Health Alliance, and Intermountain Health. You are probably all logged into the wireless access thanks to Connect for Health Colorado. We have an amazing lactation room for anyone who needs it, including a sink and a refrigerator, which is key to all lactation rooms, I have learned, thanks to Caring for Colorado. And we also have a prize that will be given out at the end of the day for registration from Green Spaces. So please, again, join me in thanking all of our sponsors for their generous supports. Thank you. Okay, we are slightly ahead of schedule, which is excellent because if we want to spend any extra time, it's right here. We are starting off very strong on our conference today, sharing with all of you the results, some of the highlights of the 2023 Colorado Health Access Survey. And I want to reiterate, these are highlights. We will have a full rollout of all of the CHAS findings in February of 2024. So stay tuned for that, but we'll share some hot off the press items. We are going to be calling today's presentation Peaks and Valleys. When we looked at the data for 23, we found that it really provided us with both. We see some pretty tremendous peaks, and we also see some valleys in the data. As a trendable survey, we can look in the rearview mirror, and the CHAS allows us to understand what this point in time represents. Is it a peak or is it a valley? But we also were curious to see what future CHAS will show for us. All right, so before we get into it, I just want to get a little sense of everybody in the room. So I'm going to read off a series of statements, and if you're in the room and they apply to you, please stand up and stay standing. And if you're part of our virtual audience, just raise your hand. So stand up if you have ever participated in a listening session or a community meeting to refine or develop CHAS questions. Anybody? Yeah, we got one. Okay, stay standing, Michelle. Amy, that's right. You have to be standing, you two. Don't sit down. How about if you have ever downloaded a CHAZ data file, a data brief, anything from CHI's website about the CHAZ? Go ahead and get yourself standing up. There we go. Stay standing. Please don't sit down. Okay, how about if you contacted CHI to help you download a data file, pull some crosstabs, or maybe provide you with some unique data? Anybody? Anybody contact a CHI? Or look at all you self-service folks. Love that. Okay, how about, we've got 5 on the online audience so far. How about if you have ever used CHAZ data for an evaluation, a needs assessment, a report, a data dashboard? Anybody use CHAZ data in any of the work that you do day to day? Okay, we got some hand waving too. Yep, see some more standing up. And how are we looking on the online audience? I'm guessing, oh, we've got double-digit hands now coming from the online. Okay, great. Well, look at all of you. I'm so excited. You can sit down now. Thank you. I appreciate that we might have some selection bias.
Coverage. No CHAZ presentation would be complete without an examination of the uninsured rate. So this is the proportion of Coloradans who indicate 6.6% approximately. Well, what did we find in 2023? We actually found that the uninsured rate dropped to 4.6%. I realize, yeah. Now, I realize that this may come as a surprise, and I know this is on a lot of people's minds, but let's talk a little bit about why this was. And by the increase, states drove and the uninsured. Look at with this graphic. Each of these bars represents 100% of the state's population, and we have 2023 at the top, followed by the last 2 surveys, 2021 and 2019. Well, we'll start with the uninsured rate. What I just showed you, 2021, we saw that the rate dropped from about 6.6% down to 4.6%. One interesting thing that we observed in the data was that employer-sponsored insurance, so this is the proportion of Coloradans who indicate that they get their insurance through their employer, it actually stabilized over the last 2 years. We had seen a decline during the pandemic by a couple percentage points from about 52% down to just under half of Coloradans reporting gaining coverage through their employer. And that stabilized at about 49% here in 2023. And what we feel is the main key driver of that lower uninsured rate is the increase in the proportion of Coloradans who indicate that they have Health First Colorado coverage through the state Medicaid program. We had seen an increase in the proportion between 2019 and 2021. This increased to the point where about 30% of Coloradans indicate coverage through Health First Colorado. I know that there is a lot to unpack here, but I want to make sure that we have time to look at how the uninsured rate varied across the state. So let me orient you to this map. This map is mapping the 21 health statistics regions here in Colorado. These were developed by the Colorado Department of Public Health and Environment. In the urban areas, they include single counties for the most part, and in the rural areas, they're groupings of counties. Also on this map, the lighter colored regions represent a lower uninsured rate. So you can kind of think about the darker colored navy blue regions as having more people covered or a higher proportion of people covered. So once again, we observed that the region with the highest uninsured rate is that I-70 corridor, that mountain resort those mountain resort communities west of Denver along I-70. And in fact, this was one of the regions where we actually saw an increase in the uninsured rate from about 10% in 2021 up to about 12%, 13% in 2023. For the first time, we actually did not have a sufficient enough sample in some of the regions to even estimate the uninsured rate. So this is a sufficient enough sample of people lacking insurance to estimate the uninsured rate, and this affected counties along the Front Range. So Larimer County, Boulder, Broomfield, Gilpin, Clear Creek, Park County, Teller, and Douglas County. We couldn't calculate the uninsured rate. So these are grayed out here on the map. Before we get too excited about the low uninsured rate, I want to bring up some considerations that are on a lot of people's minds in this room of Medicaid enrollees. Or coverage through Connect for Health Colorado, for example, perhaps other coverage sources. Could I just see a raise of hands, either online or here in the room, of anybody who is involved in these efforts of keeping Coloradans covered? Yeah, quite a few of you. So this redetermination process is currently underway. It is unknown at this point how many people will continue to stay covered and how many people will become uninsured here in the state. The Colorado Health Access Survey was administered between approximately March and August of 2023. So we feel that what is actually reflected in the data is not the redetermination process and anybody who may have lost enrollment. On the contrary, it's actually showing the increases in enrollment that we experienced during the pandemic through Health First Colorado. Future CHAS efforts will be able to reflect these redetermination efforts for redetermining eligibility and people's coverage. Our state's insurance for some mentions started measure. Our next important
from figure we've been collecting since important information on the CHAS so that we can better understand mental health care and access in Colorado, in our state. So in this figure, the green bar represents those who reported poor mental health. And in the purple bar, this represents the percentage of people reporting that they didn't get the mental health care services that they needed in the last year. So since 2013, there has been an increasing percentage of people who report that they didn't get the kinds of mental health care services that they needed in the last year. And in tandem, we see that there is also an increasing percentage of people reporting poor mental health. So when you combine those together, this really shows an increasing need of mental health care services in our state. Now, what might be the barriers that make it difficult for people to get the kinds of care that they need in Colorado? So in this figure, it also outlines two really integral barriers to seeking mental health care that is captured on the CHAS. The first of which, which is already displayed in blue, being cost as a barrier. And the second, in yellow, being those that reported that they weren't able to get an appointment when they needed one. As we can see here, as the change over time, cost is no longer the leading barrier that makes it difficult for people to get care. Instead, we see that many Coloradans now just have as difficult of a time getting in front of a provider as they do avoiding costly care bills and other costly just things associated with their care. And when we dug a little bit deeper, the data suggests that this decrease in the cost barrier may be associated with the increase in Medicaid coverage that we saw in the last couple of years. If you're interested in exploring more about mental health as well as the youth perspective, you should check out the breakout session Screens, a youth-led guide to mental health in the age of social media, which is today at 1 p.m. So I'm going to hand it back over to Jeff to talk a little bit about climate change.
Thanks, Lindsay. When we were developing the survey for the 2023 survey, there was a lot of interest in understanding the impact of climate change on health. And so this was the first time, as I mentioned, that we included a couple items on the survey about how Coloradans are affected by climate change or whether they feel that their communities are prepared for a climate-related disaster. And what we found is that with this baseline data, about half of Colorado adults indicated that they did not feel that their communities were prepared for a disaster. The question on the CHAZ was only asked of adults 18 and over, and it was how well prepared their local community was to respond or recover from a climate-related disaster. And what's shown up here on the graph in the orange bar is that about 46.9% of adults indicated that they felt their community was not prepared or only somewhat prepared for a climate-related disaster. Another 48%, approximately, represented by the blue, were in these categories of moderately or well or very well prepared for a climate disaster. And then we had about 5–6% who indicated that a changing climate isn't associated with disasters. Now, what I feel is really interesting is looking at the geographic divide here. When we look at the map, again, the lighter colors here represent the proportion of people who feel that their community is not prepared for a climate-related disaster. We find that some of the communities, Denver, Adams County, some of the Eastern Plains regions, upwards of 50 to 60% of adults indicated that they did not feel that their community was ready or prepared for a climate disaster. Whereas on the western slope, we saw more around 30% of people indicating that their community was prepared. And it causes me to wonder whether some of the communities that have experienced wildfires or the threat of wildfires more frequently may be better prepared or feel that they are better prepared because of that. One other stat that I wanted to mention is that we also asked adults 18 and over about the impacts of climate change on their health or on their family's health in the past year. And we estimate that about 2 million Coloradans, when we statistically weight the data, 2 million Coloradans believe that climate change is affecting their health. And I would encourage you to attend the Acclimate Colorado breakout session later today, where our colleague Karim Ahmad is going to be diving a little bit more into these data and some of these issues. So now back to Lindsay to take us home, so to speak.
Thanks, Jeff. So struggling to afford housing is now a shared experience by hundreds of thousands of Coloradans in our state. And this isn't a new issue. But things don't seem to be getting any better, and inequities still exist. And in 2023, housing instability returned to pre-pandemic levels. So let's check out a few CHAZ housing measures and see how housing has an influence and impact on someone's own health. This figure outlines the comparisons between the state average, in red, homeowners in blue, and renters in green. And this measure is actually those who reported that they didn't believe they would have stable housing in the next couple of months. As we can see, there is a stark difference between the kinds of the reported stable instability housing measure across different kinds of home ownership. The CHAZ has been integral in tracking social determinants of health measures, among many others, during, before, and after the COVID-19 pandemic. We can see that while there was some relief experienced with these individuals in the 2021 post-COVID environment, housing instability issues for these groups have returned to pre-pandemic numbers. This means more people experiencing housing cost issues and more people having to make decisions about what they can and can't afford for them and their families. And many inequities persist in housing instability and cost issues. So this figure, we actually collected a new measure on the CHAZ this year, which is someone reporting that they weren't able to afford their rent or mortgage in the last year. And I'm going to display a couple different bar graphs, but first let's take a look again at home ownership. So this figure reports those who said they weren't able to pay for their rent or mortgage by home ownership again. And as we can see, renters are almost or over 4 times as likely to report that they experienced this issue in the last year compared to homeowners. And we see that in the Colorado average, about 13% of people reported that they experienced this issue. Another really important inequity that we wanted to highlight is by race and ethnicity. So again, this is those who reported that they were unable to pay for their rent or mortgage in the last year. And as we can see, different groups experience this issue differently. For example, Hispanic or Latino Coloradans were more likely than other racial or ethnic groups to report that they experienced this issue in the last year. So when we take this all together, we can still see that there is a lot of improvement that we can work on around this issue, around housing and cost issues. So what's kind of the implication for this information? Well, a big one is that health and housing are related. So this figure outlines the connection between housing and health. So on the left, we see those Coloradans who reported that they were worried that they wouldn't be able to have stable housing in the next few months. Whereas on the right, we have those that did not report experiencing this issue. And the blue bars in the donut chart, they represent those who reported excellent, very good, or good overall general health, whereas the yellowish orange is those who reported fair or poor general health. So as we can see, those who reported experiencing housing instability were nearly 4 times as likely to report fair or poor general health compared to those that didn't report this issue. And this has big implications not only for these families' ability to afford their basic needs, but also the reality of those individuals facing worse health outcomes and burden of costly care down the road. So there has been much discussion around this issue, of course, at the legislative level. So for a deeper dive into housing issues and the possible policies that could help reduce burden on Colorado families, make sure to catch the Health Policy and Politics in 2024 legislative session today at 2:30. All right, so that was a lot of information. So what should we be thinking about today as you kind of move through the different sessions? So let's kind of take a tour back through the different 4 key takeaways that we discussed during the presentation today. So first, Medicaid drove coverage rates to a new high. Second, an even greater number of Coloradans couldn't get an appointment for the kinds of mental health care services that they needed. Third, half of Coloradans say that their community is not prepared to respond or recover from a climate disaster. And lastly, housing instability returned to pre-pandemic levels. So as Sarah and Jeff also mentioned, this is just a small snapshot of the data that we will have available for you all. So mark your calendars for February 15th, as that will be our big data launch for all the different products that we have available for the data on the CHAZ. And if you have any questions or anything that you want to reach out to us about the CHAZ, we have linked up our CHAZ email address up here that you can use to reach out to us for any questions that you have. And in addition, we're going to post this presentation on our CHAZ website as well, which is also here on the slide. But thank you all for tuning in and getting a little bit of a Chazzy Chaz, a little serving of the CHAZ data that we have available for you.
Yes, thank you all. And as I mentioned, we unfortunately don't have time in our agenda today for a question and answer period, but stay tuned in February for the release of all of the 2023 Colorado Health Access Survey findings. And now it is my honor to introduce our keynote speaker, who will help us look into the future of artificial intelligence and consider its impact
I have been with CHI for around 8 years, and for the past couple of years have led our work on our behavioral health initiative, and have had a long-standing interest in this specific topic. So I'm just so excited to be here today and to get to hear from some great young voices across the state on social media and what it means for them. And I'm joined by my colleague, Suman Mathur.
Yeah, hi everyone. My name is Suman Mathur. On their thoughts around social media.
The state sharing their relationship with social media. That's going to be about 5 minutes long. Then Suman and I will come back, share a little bit about what the evidence currently says around social media and youth mental health in Colorado and the U.S. today. And then we are going to spend the last half hour hearing from a really fabulous youth panel moderated by Allie Daly, the policy director at Partners for Children's Mental Health, who will share what they're kind of thinking about in terms of reactions to everything that we've heard and the state of social media. We will not be taking questions at the end. So if we end up getting out a little early, you'll get your first choice of the snacks at the break. But yeah, so without further ado, I'm going to go ahead and start this video.
I think it's just these platforms share their experiences, like your excitements.
A way to communicate with others and like whether the world.
To me, social media is like a platform where things sometimes that can be good, but a lot of times it can be detrimental.
With friends, it's so much more than
Pinterest, messages,
Snapchat, Instagram,
Snapchat.
I don't use social media, but I guess like Pinterest counts.
I love Pinterest. It's so great.
I use Instagram, TikTok, and Pinterest.
I don't have Twitter. I don't have Facebook. Those are not really our generation.
It's definitely to just stay connected to a world that feels very disconnected. People often use social media as a platform to raise awareness to like things that are happening in like the world or like in their community. It's also a place where people can like uplift their like the creative aspects of themselves.
Some of the best things about social media is like being able to track like what your friends are doing and like seeing what is going on around the world.
it allows us to just stay connected with friends, make plans with friends, see what our friends are up to.
It's also connection between employers on LinkedIn. It's also connection between just friends that you might not have seen for a long time. It's connection between my grandma who just got Instagram.
It brings you closer because you can see like what they post, and so you can like find like something common, like, oh, you do that, I do that too, and then like bond off it.
Like being able to share like a funny video that I've seen to my friends and then laughing at it like in the chat, but then also going to school the next day and rewatching it and be like, ha ha ha, that was so funny.
Personally, I really like watching cooking videos. I think that's the best thing.
Like bullying, kind of, and like negative comments that people put on your videos?
I would say FOMO, and for those of you who might not know, it's fear of missing out. Just because I use social media to connect and to stay a part of these, I guess, mini communities.
But social media drives a lot of comparison in our day-to-day lives, and just very subtly and naturally, and it really does steal your joy.
Certain ways, and I'm like, oh shoot, am I like supposed to be acting like that?
It's hard to see these supermodels on Instagram like always looking great, and then it's just like, oh well, I'm in bed at 9:00 p.m. looking like this.
A lot of these apps, these social media apps, are designed by these companies to have you on them for as long as possible, and it kind of gets to the point where you don't even know what you're looking at anymore, but you still just keep swiping.
I like have to put my phone away like 30 minutes before I go to bed sometimes, because other than that, like, I will just keep scrolling and scrolling because it's just like, I want to know more.
If you aren't careful with what you're watching or like seeing, you can get really insecure and stuff, and it can cause like a lot of negative feelings.
I feel like I have to have a good looking Instagram, because now, like, thinking about me, especially going into college next year, how am I going to find a roommate? I'm going to give her my Instagram. What if she doesn't think my Instagram's cool? What, she's going to make a whole assumption about me based off of my Instagram.
I honestly think I'd be very grateful if I didn't have social media anymore, but the only downside, because I do post a lot.
So important. We live in an age now where like social media plays a very critical part of our lives, whether you want it to or not.
If this situation where I'm losing all of my social media was happening to everybody else my age, everybody I viewed as relevant, I'd be completely fine. I wouldn't even care if it was just me and nobody else. I'd probably think like, wow, I'm under a rock now.
Maybe like, bummer.
Relieved. I'd be relieved. I think it's a lot of weight I don't want, but I have because of the generation I'm in.
All right, so we heard from a lot of different kind of perspectives on social media in that video. So if there are really only 3 things we want you to take away from the end of today's session, because there's going to be a lot of information throughout, we want to kind of start with what those 3 things are. The first is that, as we heard, young people themselves are concerned about social media. For me, the most, I think, surprising part of that entire video was at the end when the young folks were asked, what would it be like if social media went away? There was this palpable sense of relief that a lot of people expressed. The second is that it is not just people's personal stories. There's also emerging evidence and studies that show there are potential dangers to social media, especially when it comes to youth mental health. And third is that youth really need to drive a lot of these decisions. There are a lot of opportunities we have to put policies in place like age restrictions. Guess what's really easy to circumvent on a website? An age restriction. And so, you know, the decisions that get made here, we can make policy decisions, but at the end of the day, the person actually holding the phone is probably going to be driving a lot of these decisions, which is why we are beginning and ending with Youth Voice today. But first, let's do a level set of what we even mean by social media. People define this term broadly, as you heard in the video, and so there are some obvious answers, kind of the usual suspects like Facebook or Snapchat, but then there are potentially less obvious ones like video games that have some sort of social interactive component. People consider those to be social media as well. But no matter how you define it, there are a ton of platforms out there. And so just for fun, let's give ourselves a quick quiz. I won't make anybody name all of these because we only have so much time. But for an additional raffle ticket for today, can anyone volunteer to name these 6 social media platforms? Please raise your hand. Folks who are online, I'm sorry, you can just put it in the chat if you want to impress your fellow attendees.
Green sweater back there had a hand up.
Yeah, I saw that. Yeah, that's the first hand I saw. You're missing the one in orange.
I said Instagram.
Oh, the little one in orange. Well, how about we give you a ticket anyway? Anybody want to guess that sixth one? SoundCloud, exactly. 2 tickets today. It takes a village. I didn't know all of these either. All right, so great. So social media is broad. We know that. So what do? We panic, of course. Social media is everywhere, and it's destroying our society, and the corporations are bit by bit prevailing. Maybe this is premature. That is the question we are going to be exploring today, is it time to panic? And so let's think about what people are saying. We noted earlier that the concern here is not just coming from those of us who didn't grow up using social media. Again, you heard a lot in the video about people expressing concern around it and its impacts. And so first, let's acknowledge that people themselves often say there are good aspects to social media. This is a mix of headlines and quotes we heard from young folks in preparation of today's presentation. You can see people saying it exposes them to other cultures, even if they can't travel. It exposes them to new ideas. It helps you stay connected to the people that you care about. In other work that we're doing, people have told us that they use social media to connect with people with a shared identity when they have a hard time forming that community in their daily lived lives. My dad was in the Navy, so I grew up moving around every 12 to 18 months. And I do sometimes wonder if I had grown up in an age of Facebook or something similar, might I have retained some of those childhood friendships and feel a little bit more rooted than I do. So I don't want to paint with too broad of a brush here when we talk about the potential dangers of social media. But let's not hide the downsides either. We have research, and again, we have young people themselves saying that social media causes anxiety, it makes them more distracted. They note the intentionality on the part of social media companies. Some people even told us they forget to eat when they're engaged with their phone using a social media app. And so as you can see, there is good and there's bad. I will say it was a lot easier to find the content for this slide than it was to find the content for the slide before it. And the data back this up. Here we are looking at rates of poor mental health among Coloradans ages 10 to 18, which we define as having 8 or more days of poor mental health in the past month. And this is a 4-fold increase in recent years of people 10 to 18 saying that they are experiencing poor mental health. That 2023 CHAS number, which we are sharing for the first time today, shows that more than 1 in 5 people in this age group are reporting poor mental health. And we're looking at this broad age group of 10 to 18 because even though most social media platforms restrict use to 13 or older, 40% of kids 8 to 12 have social media and are using it. And a lot of stuff has happened over these past 8 years, like there was a pandemic, schools closed down, worsening effects of climate change. But it feels like we can't dismiss how closely this tracks to patterns of social media use, especially when there is emerging evidence that links why these two might be connected. So again, today we invite you to panic a little bit, because I'll admit there's a lot we don't know. Data are lacking, and social media companies are famously non-transparent when it comes to sharing their data or sharing studies about the effects of their products on young people and people in general. The pace of research is not keeping up with the pace of social media growth and use, but there is evidence beginning to emerge, and it is potentially a very urgent issue.
Thanks, Emily. So as Emily noted, we do know that there is emerging evidence that points to some of the potential dangers of social media, specifically how it pertains to youth mental health. Now, I want to acknowledge that social media itself is a very broad topic. Earlier today, we heard quite a bit about privacy and legal regulation, or at least enough that I sort of want to throw my Apple Watch away, but I can't. But today, we're really going to focus on issues that were identified by our youth leaders who are joining us today, who came up with some of the top 5 most pressing issues for young people as it pertains to their mental health. So the first is sleep. We know that sleep matters for more than just acing second period chem class. But what is the connection between sleep and mental health? and social media. Second is social comparison. Many people refer to social media as a highlight reel that really only shows us the glitz and glamour of peers' lives. How does that impact how youth feel about their own mental health and well-being? Third is attention, or the lack of, that social media contributes to. Fourth is cyberbullying. This is a concerning issue, and one that happens in a space that many adults, including parents and teachers, have no access to themselves. And finally, algorithms. How does data inform the type of social media content young people are exposed to online and on apps, and how does that in turn affect their worldview? So I want to acknowledge that as we were putting this presentation together, quite a few of these struck a chord for me as well. Does anyone feel similar? Are any of these resonating with you? Okay, I'm seeing quite a few nods, so we definitely are not alone here. But what I do want to recognize is the critical importance that is the adolescent period. During adolescence, neurons and synapses are firing and wiring, and young people are making connections not just with their peers and with adults, but with their community at large. Social media adds a whole new layer of complexity to this period, and that's really why we're focusing in on this topic today. So let's get into the evidence, starting with sleep. Data shows that more screen use is in fact associated with less and poorer quality sleep. There are a few different reasons for this. 1 in 3 teenagers report that they stay up past midnight on social media. If I'm doing the math correctly, a 1 a.m. bedtime coupled with like a 6:30 a.m. wake up time during the school week is not enough sleep for anyone, but much less a teenager. And there are a couple things at play here. We heard on the video just how easy it was for people to scroll and swipe while laying in bed. But actually, data says that the more concerning issue are apps where you're constantly messaging or engaging with peers or the online community. It's really hard to put your phone away on the nightstand knowing that you might be missing out on a really crucial or important conversation. And finally, blue light. We've known about the challenges of blue light for a while and how it impacts our internal circadian rhythms and our body clocks. And there are a few ways to kind of mitigate these harms, right? We have blue light glasses, and there are certain features that turn screens yellow the moment the sun goes down, but these aren't entirely foolproof. I know that I don't really enjoy watching Netflix with a yellow hue when I'm trying to wind down before bed. And this is all important because less sleep is associated with poor mental health. And with young people in particular, we see increased rates of depressive symptoms, including suicidal ideation and thought associated with poor quality sleep. Again, this is about more than just chemistry class. So now I want to talk about social comparison, and I'll admit that this sort of hits home for me right now. I am currently in the process of wedding planning, and as a result, I get very niche targeted social media content. In fact, if I had $1 for every image of a destination wedding in Tuscany that Instagram showed me, I still would not be able to have a destination wedding in Tuscany, to be clear, but it's not great. And while this isn't great for my budget right now, if I think back to my high school self and there's some sort of equivalent situation, it might really hit a chord. So, sure enough, we see that nearly a quarter of teens say that these platforms make them feel worse about their lives. About a third of teens say that social media platforms make them worry that their friends are hanging out without them, a phenomenon known as fear of missing out, or FOMO. And finally, over a third of teenagers report that they feel overwhelmed by all the drama on social media. And we know that if you aren't quite part of the conversation or you feel like you're on the outside, that doesn't feel great either. We also see some gender differences when it comes to social comparison, with teenage girls reporting increased rates of social comparison across the board. And unfortunately, this is associated with things like body dysmorphia and disordered eating behavior.
All right. Turning our attention now to attention. I would like to start with a quick poll. Who here has looked at their phone since this presentation began? Summon, you're doing the presentation. Okay, yeah, so I was also going to ask who here has wanted to, but actually I think the majority of hands were just raised. And the folks who are online, I'm just going to acknowledge that I myself have sometimes dared to switch tabs while I'm watching a virtual presentation, so I'm going to assume that a few of you have as well. Phones, as we know, are pervasive, and it's really hard to talk about social media without also talking about the technology that we are constantly using to access it. Does anyone want to guess, for another raffle ticket, thank you, Robin, the year that we hit a milestone in America where now more than half of us own smartphones? I heard 2020, no. Here, let me give a hint. 2007 is the year the iPhone was introduced. Sorry? There's enough guesses here that I'm going to actually ask them to get it right before the raffle ticket instead of playing it as fast and loose as I did last time. Sir? Yeah? Close, up, go up. 2012, okay, yes, 2012. So 5 years after the iPhone was introduced, more than half of us had one in our pocket. Today, the vast majority of us do. So we know that, that smartphones are pervasive and that they also, interestingly, reduce our cognitive capacity and our ability to focus on a task just by their mere existence. So your phone can be turned off, it can be turned over, it can be slid across the table, and studies still show that we have a harder time focusing on a task when that is the case. Of course, most of the time, our phones aren't even turned off, right? We have them for a reason. The average number of hours per day that teens are spending looking at their screens has increased 30% in just the past 6 years. And teens get an average of 237 notifications per day on their phones. This is an average. For heavier users, it's even more. A fifth of teens report getting more than 500 notifications on their phones every single day. And these can become so pervasive that there's even a phenomenon called phantom vibrations where you think you hear or feel a notification, but you actually don't. And this distraction and this constant turning of our attention invokes anxiety and stress responses. And again, as someone said earlier, I want to reiterate that we know this is not just something that's true of young people. When we were rehearsing this presentation, in preparation for today, a lot of our colleagues here were nodding when we started talking about phantom vibrations and the anxiety responses. But the sheer number of notifications that we're talking about here and the amount of screen time and the especially risky effects to mental health during this period of adolescence makes this problem especially concerning when we're talking about young folks. Fourth, bullying and harassment is nothing new among teens and adolescents, but these platforms, these social media platforms, do allow for this strange combination of being both anonymous but also having what you say be very public that make these concerning behaviors even more harmful. 46% of teens say that they have experienced bullying or online harassment. And this includes physical threats, spreading false rumors, receiving explicit images without your consent, or having images of you shared without your consent. And compared with younger teen girls or with teen boys, girls 15 to 16 are more likely to experience more types of cyberbullying, specifically when it comes to having false rumors spread about them or comments about their appearance. And people who have experienced this type of online harassment are more likely to also experience a host of poor mental health outcomes, including depression, suicidal thoughts and behaviors, and post-traumatic stress disorders. And finally, algorithms. Algorithms are those things that decide what to show us on our social media feeds. So some of you may remember in the early days of social media, it was just kind of this neutral list when you went onto social media of what everybody had posted from the most recent to the least recent things. But now algorithms are used to bump certain types of content over other types of content so that you're more likely to see it. And that certain type of content tends to be extremes. That's what algorithms drive us to. And a lot of those extremes are really, really toxic. 64% of adolescents say they are often or sometimes exposed to hate-based content on social media, whether that is sexist, homophobic, racist, or religion-based hate content. But unfortunately, those are types of exposures that I think hit a lot of us at all ages. Something more unique to young people is the degree to which they are targeted by sites or content that normalize or even promote disordered eating, cutting, self-harm, suicide, or other dangerous and concerning behaviors. And I want to say that these aren't incidental to the reality of social media or the internet. These are things people are driven to by algorithms that were really intentionally put in place by social media companies because they work. These business models are built on user engagement, and we are so engaged when our beliefs are being reinforced, when we are experiencing things that evoke moral outrage related to those beliefs, and when they feel validated. And that's really the last point that I want to drive home about algorithms today and social media, is it's not just the presence of these potentially harmful things on the internet, it's the way in which, central to the business models of social media companies, we are guided to them.
And that takes us to our final takeaway today, which is that youth must drive many of the decisions around social media regulation, guidance, and possible solutions. Now, there is some guidance out there already. In fact, organizations like the American Psychological Association and the US Surgeon General have put out some really solid advisories. Is anyone aware of these documents or read them yourselves? Okay, I saw like 2 hands in this room. And here's the thing, I am and always have been a self-professed nerd, and even I wasn't reading US Surgeon General advisories in high school. Social media is so nuanced, so complex, so personal, and the way that young people use it changes so rapidly that in order for any sort of guidance to actually work and make a difference, it has to come from young people themselves. So let's recap. 1, we heard that young people are worried about social media. And there is evidence that points to some of these potential dangers. In order to really help resolve and move forward with some possible solutions and recommendations, youth voice must drive these conversations. So with that, I am excited to hand off the mic to some of our local youth leaders who are joining us here today from the Metro Denver area, as well as their fearless leader, Allie Daly. Let me move my phone out of the way here so I can properly introduce them. Allie Daly serves as the policy director at Partners for Children's Mental Health and the senior behavioral health policy coordinator on the government affairs team at Children's Hospital Colorado. Prior to her time at Children's Colorado, Daly litigated mental health and substance use disorder commitments as an assistant city attorney with the city and county of Denver. Daly has a BA from Boston University and a JD from the University of Colorado Boulder. As I said, we also have a number of youth leaders here today representing a few different organizations. The Youth Council on Mental Health is convened by Partners for Children's Mental Health and is a youth-led, adult-supported effort to positively shape the future of youth mental health in Colorado. The Colorado Youth Congress is a youth-led initiative committed to elevating the voices of youth through empowerment and civic engagement. And finally, Young Aspiring Americans for Social and Political Activism aims to build the self-efficacy of youth who desire to make change in their communities, pursue social science degrees, and social justice careers. Please join me in welcoming them to the stage.
Okay, can you hear me okay? Awesome. Well, I'm really excited to be joined by this outstanding group of youth, and I'm going to do some quick intros so that you know a little bit more about all of them. I'll start with Caitlin. Caitlin is a passionate mental health advocate, currently completing her undergraduate education at the University of Colorado Boulder. She enjoys spending time at the state capitol, assisting as a legislative intern, lobbying, and testifying for mental health access bills. She serves on several national and state boards focused on mental health and activism, including the Youth Council on Mental Health. She co-authored the Teen Lifestyle Medicine Handbook that's now being shared nationwide across several hundred schools. She's presented both live and online for many different events, including the 2022 National Alliance on Mental Illness Conference, and has been interviewed for a book, podcast, and local and national news stations on youth and young adult mental health and the power of change. Next to her, we have Jacqueline. Jacqueline Ruiz Rivera is a senior at DSST Montview High School. She values being an active part of her community and taking leadership roles. She volunteers at Children's Hospital Colorado and is an active member of the Colorado Youth Congress. She's passionate about looking into complex systems and collaborating with others alike to dive into a deeper understanding about these systems. In the future, she wishes to continue to play an important part of her community, helping others around her. And next to her, we have Stacy Adimu. Stacy is a Black Togolese woman who is currently serving in her first year at the University of Denver, majoring in biology. She currently serves as a youth advisor for the Youth Council on Mental Health, and she hopes that her passion for mental and public health will lead to her becoming a physician. She enjoys reading and learning new hairstyles to braid on herself. Next to Stacy, we have Fortunate Madike. Fortunate's journey involves more than academics. It's a mixture of community engagement and personal growth. From advocating for education reform and student affairs with the Young Aspiring Americans for Social and Political Activism, or YASPA, to managing her own pastry and hair braiding businesses, she has embraced diverse roles. With a 4.4 GPA, much higher than mine was, and in the top 5% of her class, Fortunate thrives on the challenges of rigorous courses. This has led her to programs such as YASPA that allow her to utilize not only her academic skills, but also her community engagement skills to help both worlds. And then finally, we have Chanel Jones Ahmed. She's pursuing her studies at the University of Colorado, Denver, majoring in business entrepreneurship and architecture. Beyond academics, Chanel enjoys guiding individuals through home transactions as a dedicated realtor. Additionally, Chanel is part of CU Boulder's Voices of Healing research team and serves as a steering committee member for food justice in Northwest Aurora. Outside of those spaces, Chanel finds joy in spaces dedicated to community engagement, particularly those focused on social justice, youth advocacy, and fostering a positive, healthy culture among youth of color. This year, Chanel is enthusiastic about her role as a youth leader for the Youth Council on Mental Health, where she aims to inspire change and challenge the stigma surrounding mental health. That is impressive. So I'm really excited to be here to talk about this topic with you all. And I think to start, we just want to frame that we know that there's lots of positive aspects of social media, and we know that there's lots of potential risks that we just heard about. Could each of you start and just share sort of your why for wanting to be on this panel, and then share one positive aspect of social media, and then one negative or risk of social media? And let's just go down the row. We'll start with Caitlin.
Sounds great. Yeah, so my name's Caitlin Tollefson, and I'd say one of the big reasons why I'm on this panel today is social media has affected me time and time again. It's when we were in COVID, I had a screen time of, dare I say, about 15 hours on social media. Not amazing, not amazing. Sometimes it got up to like the 20-hour limit. And this was essentially where I kind of like reached my point of like, this is not okay. This something needs to change. Something needs to change. But I will say a really big positive with this is that it is such a useful tool for connection. It's the exact way how my entire friend group in high school communicated back and forth. We would never text on iMessage or anything like that. We would only use Instagram to text. So I'd say that connection is incredibly, incredibly important, but also it can be incredibly, incredibly addictive. So yeah.
Jackie, go ahead.
My name's Jackie, and I'm a senior in high school. I think social media overall I think it's really great for networking and being able to put yourself out there. I think, however, also has a big impact on how people, specifically teenagers, on how they view themselves. And I think overall that can really affect their academics and what they think of themselves overall.
Hi everyone, my name is Stacy Adimu, and I think my why for why I'm even on this panel is because I think as a Black woman it's very hard to find your community. I grew up in areas where I was always the only Black girl. I didn't really have anyone that looked like me, and being able to go on social media and find people that look like me, people that thought like me, people that could introduce me to authors like Audre Lorde, Bell Hooks, introduce me to like the works of Black women. I think that's like why I like find like social media is so useful, but I also do see the risk with social media, especially when it comes to mental health and like people kind of like being lost in social media is a really big risk to me. So I think that one benefit is people finding community, and I think one risk is people thinking that's the only community they have available.
Hi, my name is Fortunate Madike, and the reason why I'm on this panel is very similar to Stacy's. Because I'm a Black woman, and I guess it's Colorado, it is somewhat diverse. It's not really easy to find my community where I'm also Nigerian, so where I could be myself, express hair struggles or experiences as a Black woman. So with social media, I'm able to really express myself to the fullest and connect with other people who also live in Colorado. And I would say something positive about social media is that you get to showcase yourself and really express your ideas. And I would say something negative is that it's not always used the way that it's intended to be used and could lead to harmful damages.
Hi, my name is Chanel Jones. My why about being in mental health kind of goes back to how I was raised. So in my family, they really didn't acknowledge mental health. It was kind of like, you're fine, you'll get over it, you know, she's just mad, she's just upset, leave her alone, and it wasn't something that was ever discussed. So, like, seeing that obviously reflects who you hang out with, how you show up in other spaces, how you talk, how you involve yourself with other people, and I feel like myself, I wanted to overcome that generational, I don't want to say curse, but like I wanted to be aware of mental health and not just push it aside. I feel like a good thing about social media is that you can learn new things, get access to different education, and I feel like you're able to, like what Stacy said, is like find your community. But the bad side about this is that sometimes people open up on social media and they're looking for a validation that they can't get, if that makes sense. It was earlier this January, I actually saw a comment on a reel, and it was like really weird because my algorithm was all about suicide, which was not my thoughts, but I came across this video and this guy commented and he was like, I hate it here, I just want to die. I just can't do this anymore. It's my birthday and my friends didn't say happy birthday to me. I don't want to be here anymore. And it struck me because a lot of the comments were like, real. That's so real. Yeah, I get you for real. That's cool. And I was the only person that commented, and I was like, you're worthy of living. Please don't feel this way. You're worthy of experiencing new life. And that's when, a few months later, he liked my comment, but the community was validating him. Like, that's real. And that's kind of the negative side that I could see.
Great, thank you all. I want to kind of start with thinking back to the video that we watched at the beginning of this session. One of the things that really stood out to me was when one of the youth said that social media steals your joy. And that just really stood out. I want to start with you, Chanel, actually. Do you think that social media is contributing to the rise in mental health issues among teens and young adults? Why or why not?
I think it definitely is because, like with my last example, people are very involved with things that they resonate with, and sometimes what they resonate in is kind of like a revalidation. Wait, can you repeat the question? I'm sorry.
How do you think, or do you think that social media contributes to the sort of mental health problems that youth and young adults are facing today?
Oh, okay. Well, I don't know if you guys heard of the word delulu. So it's kind of a phrase that a lot of people use, and like they kind of use it a lot for validation. So like, let's say like your boyfriend's cheating on you. They'll be like, I'm gonna stalk him, I'm gonna delulu. Like, yeah, that's cool. You could be multiple other agreeing with each other and pushing it to the side. So it's teaching you to, what's the word, like reevaluate it, if that.
Do you think of youth mental health challenges for?
Social media has definitely progressed in the years before. In other spaces, people would put on this like fake persona stating that they're perfect, and I feel like with social media, to some extent, it steals your joy because based on your algorithm, it could either show you, like if you're looking for things that you want to be, like let's say a body image that looks nothing like yours, if you keep looking at it and looking at it and looking at it again, it's definitely going to steal your joy because you don't feel like you meet that requirement. But then if you look at things based off like body positivity, with other people who agree with you and spaces where you feel connected, I wouldn't say it would steal your joy, but it would make you feel validated and make you feel like seen or heard.
Yeah. Okay, we're going to transition to how this community and your kind of community at large can sort of help support youth on social media. I want to start with Jackie. What advice would you give to youth regarding social media use?
I think definitely don't take it as seriously. I think there's a lot of misinformation that can spread throughout social media, and a lot of it can be true, but most of it can also have these negative impacts on other people. I think also using it in the correct way can also it can further opportunities for you, help you connect with other people, and overall I think just using it appropriately and not using it in a disruptive way for other people that could harm them.
Yeah. Stacy, what do you wish that parents or teachers or other adults in your life knew about social media and how they can support you on it?
So I think when I interact with all of these adults in my life, when they hear all of these statistics about social media, they think we need to ban it. Like, that's it, we need to ban it. But let me warn you, the youth will resist and we will find different outlets. So I think that when we kind of do have these conversations, we need to have an effort that's going to be effective and consistent. So I think that when we view social media, we can't just view it as this thing that's terrible, that's harming youth. And of course, those things may be true, but we do need to look at the benefits of it as well and understand that social media, it really does depend on how you use it and what you intend to get from it. So being able to have those different conversations, interacting with different youth that have different experiences, instead of just taking that one experience and thinking we need to ban it completely.
Chanel, I'm going to ask you the same question. What do you wish parents or teachers or any other adults in your life knew about social media and how they can support you?
Well, I wish that parents and people in the school system understood that just taking something away is not going to solve all the problems. I feel like when you just take away a kid's phone or make them delete an app, you're hurting them in a way because you don't understand their connection to that. I mean, what Stacey was saying, someone could just have a lot of friends on that app and they're communicating with them. You're taking away that one way they can communicate. I know a lot with my family. My brother, when he was 8, he got his first Kindle, and he was obsessed. My parents would try to take it away from him, and he'd start raging out. He still does it to this day with his PlayStation, and they never take it away from him because he's so addicted to it. So I feel like parents and like people in the school system and just professionals in general should just understand that there are other ways to remove social media away from the youth without actually just like physically removing it, because like there's so many, you can think it could be beneficial, like they're getting a break, they're getting a mental break, they're doing their homework, but on the other side you're not seeing the mental aspect of it and how it could be deteriorating to their mindset and how they see you.
Great. So there's a lot of advocates and policymakers in this room, so I want to shift into thinking about solutions and systems change, and these are really hard things to solve. So I want to think about how policymakers can better support youth mental health. And I would say the caveat to all this is that all the youth here today are representing themselves. And so if they say something about a current policy or a future policy, it doesn't necessarily reflect the position of the organizations that they represent. But just with that caveat, because I don't know what they're going to say. We didn't practice. I love it. So as many of you know, dozens of states, including Colorado, are suing Meta with claims that its apps, including Facebook and Instagram, are contributing to youth mental health crisis by knowingly and deliberately designing features on those platforms that addict youth. I want to start with Caitlin. What do you think about lawsuits like this?
Yeah, so I think this is incredibly, incredibly interesting. And while there are so many positives to social media, like the connection, the exposure to other cultures, all the different positives that were mentioned previously, it is also, and we've known this from like essentially the beginning, that social media is designed to be addictive. Now, it's not like whenever you're going out and shopping and you see behind the gas station all of the nicotine products and that have the little warning labels on them that are saying this is an addictive product, and it's well known that nicotine is an addictor. But there's also studies out there that say that even like cheese is an addictor. It'll like target the same receptors that cocaine will even target. And we don't have those warning labels on cheese, which is kind of why it's kind of similar with social media. With social media, it has been designed in a way that will kind of give that little emotional response of, ooh, I like this, let's keep going, I like this, and kind of keep you into that doom scroll. And having this platform where these different companies can specifically target their content and target our views and the media usage, because media is incredibly, incredibly powerful, as we all know, and are able to target this media in an incredibly addictive format is causing a lot of not real, I guess I'd say like chaos in a adolescent's life. But yeah, I'd say that it would be best to try to find a way to figure out how to manage social media in a way where we can maximize the positives and minimize the negatives.
Yeah. Okay, Stacy, I want to ask you the same question. What do you think about some of these lawsuits that are happening?
So I definitely agree with Caitlin's points. I think that social media, they definitely know how to make money. Personally, I love to shop. I will take every opportunity I can to shop, and I think that my social media now knows that, because every time I open that, there's always a shop feature, there's always an Amazon storefront, there's always a Target wish list that I can go on, and it's very concerning, like the way that they're kind of like tracking us. So I feel like when like we kind of do like consider like these regulations, these lawsuits, we need to have like this ground idea that we need to protect our people no matter what, protecting their information, protecting like their ideas, like protecting their privacy most of all. So I think that like suing Meta for like their things, like they know exactly how to make their things addictive, and it's very concerning to me. So we need to like, as like decision makers all in this room, we need to like take more initiative to like put an end to that.
Great. I love it. Getting some reactions. You all talked about some of the best things about social media and also some of the worst things. And we've seen in a lot of other states that they have tried to implement a lot of solutions to strike that balance that Caitlin mentioned, the maintaining positive interactions on social media and reducing some of the negative. Some of those examples are things like imposing curfews for youth that are using platforms under age 18, or requiring parental permission to access the platform. All these things that they're trying to force social media companies to do to better protect youth. I'll start with Fortunate. What do you think about some of those solutions?
There's a saying that goes, strict parents create sneaky kids. And I believe that this, I'm not a sneaky kid, but I would say that this applies to this situation. That if you, like Chanel said, if you take things away from kids, they're going to find ways around it. And instead of parents being able to help them by confronting the issue, kids are going to go around not knowingly hurting themselves by opening access to social media. And I feel like social media, because of the algorithm and the way that it's catered to everyone, youth may think that, oh, I'm a free thinker, I'm not really swayed to one side or another, but they can't really be free thinkers if everything that they're presented is catered to one bias. And so the question I would ask would be that, are you really a free thinker if your For You page is deciding for you what to think?
Oh, that's super interesting. Thank you. Okay, I'm going to ask the same question to Caitlin. You were the one that mentioned sort of this really important striking of maintaining positive and getting rid of the negative. What do you think of some of those solutions? Are they doing that?
I'm going to echo Fortunate and with the statement that strict parents create sneaky kids. I think that's a great statement, and I also think it applies when we talk even about policies. Strict legislators can possibly make sneaky kids, sneaky adolescents, sneaky young adults that are trying to use social media. So I feel like there's these different laws that are coming, or these different policies that are popping up about setting a curfew, about banning certain apps entirely, about adding age restrictions. I'm just going to look down the line right here and ask how many of you guys have put an age that's not your own when applying for an account? Yeah, I have too. 5 out of 5. Yeah, yeah, there. So it's something. The age barriers are usually something that are honestly very, very, very often neglected by many people. Whether it's signing up for a Minecraft account and you don't want to have to go ask your parents who are in the room across from you, 2 yards away, hey, can I download Minecraft? Or if it's something like getting onto a site that's restricted for adults. These age barriers don't typically tend to do much of anything to prevent kids from being on these sites. And I wanted to also say with curfews and adding parental constrictions, this then, the issue with this is often that it provides a differing level of parental supervision. And this can go in two very different ways. You can have parents that might be incredibly strict with the regulations and social media usage, and have it locked down where there's very limited times where kids can use social media. But this then also could possibly target the ability for kids to connect. Like I would be on my phone at 1 a.m., woken up by a text from one of my friends saying that they were going through a rough breakup and they needed someone to be there to console them. And so I would join on a call with them. They'd be crying. I'd be able to help assist them through the breakup. And being able to have that connection there at these odd times when life just happens is so incredibly important. And having a parental constraint where parents can possibly tighten these restrictions to a point where there's not able to be this communication could make potentially very difficult circumstances. And the reverse is also true if parents allow a great deal of freedom with social media, because I know I was allowed a lot of freedom with my social media usage, and I love my parents. But I was on TikTok for 10 hours every day. It was bad. I eventually had to delete it because I was doom scrolling too much. But leaving it up to the parents is honestly probably not the best of ideas, considering that'll put in a lot of other variables with this big decision that is causing so much stress for even for the entire world. And it's something that we need to think about in possibly other ways.
Jackie, would you add anything to that? What do you think about some of these solutions that have been tried in other states?
I think it's also building off of what Caitlin said. It's also super easy to be able to get around these restrictions, because I'm 17 now, but I remember like when I was 10, I put that I was born in like 1923 or something. I was just 17. But I think as like a high schooler also.
Okay, now a harder question. I'm gonna start with Chanel, because I believe in you. What solutions do you wish were being considered instead of some of these other ones?
That's a good question. Wait, can you ask the question again?
Yeah, totally. Are there other solutions that you wish were being considered instead of like a curfew, or is there another way that policymakers can better support you?
I mean, just like creating spaces where youth are able to talk, not have to use social media, but be in spaces where they can be engaged in those things that they use in social media. So like, let's say they're interested in gymnastics. They go to a space where people talk about gymnastics, reiterate those same things that they're looking and engaging with on social media is really important, because yes, you're interacting with your phone the whole time, but you're also trying to interact with other people online. So being able to create that space where it's in person, it's communicative, and just like physical is really important, because I know like with the pandemic and everything, social media was a space for people to contact people because we were all on lockdown. But when it got back into being in person, a lot of people developed social anxiety, but there was never spaces created to overcome that social anxiety or be able to learn how to re-communicate effectively or learn how to say responses that were more than one word. So I feel like that can be one solution. Another solution could be just creating like a relationship between one another. I feel like with social media, people are always trying to look for a relationship. Not like a love relationship, but they're looking for some type of, ongoing communication that will benefit each other. So being able to create other ways of access to those things without having to get on your phone, not being able to have like a little thing on your screen saying you're out of time. Putting those restrictions is just taking back and creating more barriers for people to connect with others. So being able to create spaces and different types of communication styles where people are allowed to communicate with each other differently.
Caitlin, what do you think? Are there solutions you wish were being considered?
Oh my gosh, yes. So this is a point that I know everyone in YCMH is like, oh, Caitlin's going to go on that rant again. I've been going on it for several meetings now. But the one idea that came up when we were discussing, since I'm on a team that really talks about social media usage in adolescents and young adults, and we're kind of trying to go over ideas to figure out what can be done to address this. And one of my favorite ideas that I think has come up in this is the idea of having mindful breaks put into social media. This was suggested by one of the members of our team, and the moment that she said it, I was like, oh, that's awesome. That's awesome. So having these mindful breaks, almost like non-skippable ads, where it would be telling you to do this like breathing exercise. Take a few deep breaths in, take a few deep breaths out, use evidence-backed knowledge and evidence-backed research on different mechanisms, different ways to get people off of social media, get people off of the kind of like loop that you get into when you're on social media and doom scrolling, and to possibly reorient that mental space, reorient that position that you're in, and move to a more positive mental space, whether that's identify like something in the room that's blue, look for something that's circle-shaped, look for something that's fluffy, or if that's take 5 deep breaths, and then you can get back to scrolling if you choose to get back to scrolling. But adding this kind of like buffer in there is something that I believe it's been something that has helped me get off of social media, and has been like essentially the only thing that's helped me get off of social media is when a random video will come by someone advocating for social media awareness, who says, okay, look for 5 things that you can feel that are tactilely different. And I'll be like, okay, I'm now like feeling different things in my world. And it really was only those type of things that get me actually like up and interacting that have been able to get me off of my phone. And I believe that this would be an incredibly useful way to try to figure out a way to better allow still for communication, but also have a way to break up the addictive cycle that social media companies are placing into it. It would be a disruptor, like an added disruptor to encourage, not to encourage, but kind of to force these companies to break up that addictive cycle and to allow adolescents, allow young adults, allow anyone who's using social media to be able to have a more positive experience.
Awesome. Okay, the time went by fast. To close this out, we're going to ask one final question that you'll all get to answer. And we'll start with Chanel, and then we'll bring it back. So there's a lot of people in this room who might not have young people in their lives, and might not be young people, and might not have grown up with social media the way that all of you did. What's one thing you want to make sure that they hear from you today that they should leave this room with?
I would say if you see your friend on social media making a comment that could be concerning or questionable, just text them and follow up on that comment, only because social media is an outlet for people to share their voices. And even though you might not see that comment as soon as possible, I think it's really important that you show up for your friends and your family and your kids and just check up on them, because those check-ins mean a lot. And just being able to show that you care and just check in often is really important because, well, can I share an example? Okay, I saw my friend this weekend, he posted, a comment, and he was like, yeah, I be taking antidepressants. I'm like, whoa, I didn't know this about you. We talk, all the time. So just, me reaching out and checking up on him was really important because, those little things that you don't know about people and just checking in with them can go a really long way.
Could you repeat the question?
What's one thing you want to make sure that the people in this room take away from today?
One thing I want to make sure that the people in this room take away from today would be that rather as adults trying to advocate for youth, tell the youth to advocate for themselves, because as youth we want to see the changes that we want to see. We don't want to see policies made by adults to affect children. As youth, we want to be able to implement our own policies. Also, I would say both youth and adults and everyone, they should focus on the positive aspects of social media. Remind yourself that, this could also be a positive space. And if you feel overwhelmed by social media and start feeling negative emotions, you could also remember that I feel like it's easier said than done, but with just the deletion of an app, the unadding of a friend, the blocking of someone, yes, they might be instantly gone, but I guess after effects might be there, but that's an option.
I think that everyone in this room can initiate change. I feel like everyone, even if you're legislators, researchers, aides, social advocates, all of you, it's very important that this is not your only engagement with youth. We do not represent youth as a whole. If you really want to initiate change, you need to be directing the audience that's going to be most affected by it, and you need to be having those conversations with youth. You need to be joining those youth activist organizations. You need to be giving them space to be youth, and you need to listen to them instead of automatically taking action. So I think that's my biggest word of advice for all of you in this room.
Yeah, I think also making the space for them to also advocate for themselves is really important. I think being able to give them the space and the opportunity to advocate for themselves just can overall make a huge difference when making these policies and researching.
I'm going to absolutely echo Stacy with saying that we need to have youth in these spaces, that decisions are being made about youth for youth. These are things that are going to affect them, and even when we were listening to some of the debate over all the TikTok stuff, hearing how youth were making comments on these debates, and we're like, okay, we have all this knowledge about what TikTok is, about what all of these things are, that are really needed in this conversation that aren't being added to this conversation. So I'm absolutely going to echo Stacey with saying that youth need to be in this conversation. And then the last thing that I'm going to say is that connection is necessary. It has been shown over and over and over again. The Surgeon General has released a book about how important the need is for connection. So social media is going to be here to stay with just that need for connection. But we also need to address it in a way where we can figure out how to put a little blocker in this addictive cycle that's being made that's affecting so many youth and young adults.
Great. Well, I cannot thank each of you enough for being here today. The intention for the audience today was to start a conversation about how social media impacts youth mental health, but we don't want the conversation to end here. As they said much more eloquently than I, youth are here and they want to be a part of the solutions, and there's a lot of youth-led organizations that are available to have intentional conversations with around some of these really complex problems. So please engage these groups directly. You can engage other amazing groups of youth that are around the state, and when you're developing these solutions, we want this to be the beginning of that conversation, and I am so thankful that I got to be a part of it.
All right. I sometimes hate it when people do this, but I really think if we could give one more round of applause to Chanel, Stacy, Jackie, Caitlin, and Fortunate, and Allie. I feel like that was really insightful for me. I learned a ton, including what Delulu is. No, I actually didn't learn what Delulu. I don't really get it. I have to look it up so I can misuse it awkwardly in my daily lived life. Yeah, as everyone said, we're hoping that this is the beginning or the middle of a conversation and not the end of it. So I just want to say thanks to everyone for being here today as well. We are now going to head into a break. There are some snacks and beverages provided outside. And I would like to remind everybody that coming back here at 2:30, we are going to be beginning our Hot Issues legislative session, which is always a very, very exciting hot ticket at Hot Issues. So thank you all so very much, and enjoy.
If one is going the medical route, there are a lot of options for that. But I think now people
introduce and then have a seat.
Good.
Perfect, perfect. Okay.
Oh, are we starting?
I guess so. All right, welcome back everyone to our final session. Give a minute or so until, as I set my timer. Well, welcome to the final segment of Hot Issues in Health 2023, our legislative preview. And immediately after this, we'll have a legislative panel. I'm Joe Hanel, I'm the Communications Director at CHI, and this is actually my 10th legislative preview at CHI. Thank you. It's my first time, though, with my new presentation partner, Kendra Newman, who is provided almost all the research and deep thinking behind this presentation. So if you like it, thank Kendra.
Well, thank you for that kind intro, Joe. Hi, all. I'm Kendra Newman, a research analyst at CHI, and I've been on our legislative services team with Joe about a year now, but have been following Colorado politics for many years, so I'm really excited to get to speak with you all this afternoon. And I'm going to pass it back to Joe to begin.
All right. Well, since we've had such success with technology today, and in keeping with the theme of the day, we decided to give Brian Clark, the hardest working creative director in Denver, the day off, and we asked AI to design our presentation. So hope you're really going to like the results. Let's see what it does. All right, computer, show us a picture of the Colorado State Capitol. Ooh. It really caught the reflecting pool so nicely, didn't it? If you've never walked around the Capitol, there is no reflecting pool. There's a golden dome, but the whole top of the thing is not gold. AI will try again next time. There'll be a few other opportunities here. Our takeaways for today, to shift to something a little less frivolous. The billions of dollars extra money from the federal government during the pandemic years, that's gone now, all but done. We are back to normal years with normal budgets, which means not a whole lot of money for legislators to play with. Second, we think it's going to be a very active year for policy in the legislature and for what we're all interested in here. We think mental health and housing are going to be two really important and hotly debated issues. And lastly, 2024 is an election year, if you might have heard, and to use a technical political science term, it's going to be bananas. So we'll go through each of these sections in turn, but first let's look back at our most recent election and some more AI art. If anybody wants a raffle ticket, can you tell me anything that might look amiss about this picture? The flags, yeah, most American flags I know have the blue field on the left, and just one blue field, not two of them, and not just 13 stripes. So raffle ticket back here, whoever said that, thank you. And if you wanted to look at this longer, you could probably find just about everything else with it is off. Let's look back at the most recent election, though, the Colorado state election just last month. The big story, of course, was Proposition HH, which was about property taxes and TABOR refunds and school funding. Colorado voters rejected it by more than 18 points. And there were a lot of reasons that they might have, and there are a lot of competing reasons. If you are a mainstream Democrat, you might, some of them blamed right-wing information during the campaign for it failing. If you're more on the left side of the Democratic spectrum, you could say that it was inequitable because it gave so much relief to homeowners rather than renters. If you're a conservative or Republican, you could say voters wanted to protect their TABOR refunds. Or if you're somebody who's just been watching Colorado politics for a while like me, you could just say that when Colorado voters see something that they don't understand, their default is to vote no. You could say any of those, and you'd be right. That's beauty of political analysis, right? But it's important because this contest to define the narrative of Proposition HH is really about a contest to render judgment on the state's Democratic leadership. HH broke a long winning streak for Democrats in Colorado, and the lessons that people draw from it are going to really affect how they execute the next year and how everybody interprets it as well. So, of course, it was only a few weeks after the HH election that there was a special session to address property taxes and everything else associated with HH. This is not an AI picture. This is Governor Polis breaking glass with the hitting the emergency break glass for special session. I kind of wish it was an AI picture, though, but this is reality. The lessons that Democrats drew from HH, at least from our point of view here, just still in the aftermath of the election, is that they seem to settle on the inequity argument with what happened in the special session. They passed several bills that did a lot of what HH did, but with more emphasis on helping out people with lower incomes. So there was temporary property tax cut, but there's also earned income tax credit, which is a proven bipartisan anti-poverty policy. There was aid for renters, and it's focused on people who are in danger of being evicted. And flatter Tabor refunds, or flat Tabor refunds, I should say. So less money for the high earners and more for middle income and lower income earners. But again, all of this is temporary. The special session in no way solved the property tax and housing price crisis here. It's not a long-term solution to housing costs. So that sets the stage for the 2024 session. Kendra is going to talk about some of the old and new faces in the legislature. I want to share with you my favorite face, that the chair recognizes Representative Bigfoot.
Great, thank you so much, Joe. And unfortunately, we don't actually have Bigfoot in our House of Representatives, though I think it would make our news headlines a lot more interesting. Hands up if you agree with me. So who does sit in the legislature? Well, as you can see, there are 100 legislators across both chambers, and 69 of them are Democrats. Democrats actually hold really strong majorities in both the House and the Senate right now. They have a supermajority in the House and are only 1 seat away from a supermajority in the Senate, which I'm sure would be an aim of 2024. You could ask our Democratic legislators who will be up on the panel in a second. But the reason that these majorities are so important is because it means that, although there are a lot of disagreements between Democrats and Republicans, of course, many of the most important disagreements that really impact the policies that pass happen among the Democratic caucus. And you'll hear me say that a couple times today, just because it's a really important dynamic in a lot of the topics I'm going to cover later today. And although there wasn't any election of legislators, we did see a couple new faces in the legislature since last session. There were 3 Democratic legislators who were appointed to fill Democratic seats, 2 in the House and 1 in the Senate, although this doesn't impact the overall balance of power. In the House, Representative Tim Hernandez took his seat for the first time in last month's special session, as did Representative Manny Rutinel. And I'll pause and say, some of you may have heard that another representative actually announced their intent to resign this morning, which means there will be another new face coming next session as well. And then in the Senate, former Representative Daphne Michelson-Janae was actually appointed to fill former Majority Leader Dominic Moreno's seat, which means that she moved from one caucus or one chamber to the other for last month's special session. And because Dominic Moreno left to go work for Mayor Mike Johnston, we also saw that Senate Democrats had to elect a new Majority Leader this summer. The man they chose was Senator Robert Rodriguez, who, if you all don't know him, represents a large swath of southern Denver. As Majority Leader, Senator Rodriguez actually has a lot of power in deciding which health policies are prioritized and deprioritized. And that's because he gets to set the calendar. And that means that at the end of session, when there's limited time, some policies end up dying on the calendar, and he has a lot of say there. And then the Majority Leader, of course, also has a lot of say in Democratic committee assignments in the Senate. And we knew changes were coming as soon as Dominic Moreno left his seat. But the two committees that we really watched closely that ended up changing are the Local Government and Housing and Appropriations Committees. And the reason I'm calling out these two Senate committees is because housing has been a really big priority in Colorado for a while. And these were two big committees where really progressive Democratic-led bills actually got caught or had pretty big changes happen. Specifically, I'll call out a rent control bill that ended up dying in Local Government and Housing, as well as the governor's highly publicized land use bill that I'm sure most of you have heard a lot about, that faced pretty significant amendments from Democrats in both of these committees. So we at CHI, and I'm sure many others in the crowd, will be watching to see how housing legislation does, especially in the Senate next session, because of these changes. And then to move away from individual faces, we did think it was really important to just name the rise in heated debates that we have seen this past year or so, and the rise in really, really long sessions, especially in the House of Representatives. Last session, we actually saw that the House of Representatives worked 8 weekend days, which might not sound like a lot to some of you, but really was, and kudos to all of the legislators who worked those weekend days. And then they also worked a couple of overnight sessions. And for a raffle ticket, did anyone here actually stay up and listen to an overnight session where the House of Representatives was debating? No. I see a representative who worked that session. Kudos to you for staying up for your job. But yes, when you combine those long hours, which kudos to all of the representatives in the crowd for working those hours, with the fact that a lot of really significant legislation tends to be introduced as late bills, that means that legislators have a lot of work the last 3 or so weeks of session. And last year, they actually had over a quarter of their bills undecided with 5 days left in the session, which means that during crunch time, when there's long hours of debating and high emotions, they have to make some important decisions about which bills they're going to let die on the calendar and which bills they will significantly amend. And I know a lot of folks who worked those last weeks probably don't want this reminder right now, especially as we're gearing up for next session. But with that, I'm actually going to turn it back to Joe, who's going to talk about the budget a little bit.
Thank you. All right, how are we doing? Well, that's exactly like the Colorado Capitol Dome, right? It tilts to the side like that, like it's about to collapse. All right, I'm going to go through the governor's proposed budget, which he sent to the legislature on November 1st. The legislature over the next 4 months or so will tinker with it, but the broad outlines usually don't change all that much. So let's take a look at some kind of takeaways from the budget. First, it's a back to normal year. That means there's not a few $1 billion extra in federal funds to create big new programs. We are seeing in Colorado some really strong economic growth. Wages are up, and that helps, and unemployment is down. That brings tax revenue into the state. It leads to a respectable 5.5% or so growth in the general fund. However, most of that money, 2/3 of it, is spoken for already by increasing demand for existing government programs. The budget economists call it caseload growth. And it could be more students, higher medical costs. Those are two big ones. So let's look at the broad outlines here. The total budget is about $46 billion, which sounds incomprehensible, but legislators deal with the general fund for the most part, and that is just shy of $18.5 billion. Of that, in this graph we're going to draw here, on the left side we'll show basically education and an or on the right side, education, and the left, health and human services. Those are the two big things that take up the state budget. So K-12 education is about a quarter of the general fund. Higher education is quite a bit less than that. This little slice is the new Department of Early Childhood and the Universal Preschool Program. Then we have healthcare policy and financing, which by dollar in the general fund is the state's biggest department. This is Medicaid. Human Services is next. This includes the new Behavioral Health Administration. And this little red slice there is Public Health and Environment, which historically has not had a lot of general funding, although that has changed in the last couple of years as the legislature has made some investments in public health. And the rest, the last quarter, is everything else. So, public safety, agriculture, the governor's office, everything, all the other things the government does through the general fund is that one quarter. Diving into the governor's budget request, we picked out some highlights that we think are of interest to this crowd. First, an extra $560 million for schools to end the so-called budget stabilization factor, or the BS factor, which is definitely a Hall of Fame government acronym. This used to be called the negative factor, which was a little bit more descriptive but less colorful, because it was it figured the amount of cut that schools took each year versus the target that voters had said they wanted schools to be funded at. So that is finally ending this year, and we're back to what a lot of people would consider full funding for schools under existing law. Next, pay raises for healthcare. Woohoo! Especially, I'd like to call out direct healthcare workers. There's more than $50 million in this budget for people with really hard jobs and low pay. This is like home health aides. And it's hard to keep people in these jobs, so the thinking is they could use a raise to help stabilize that workforce. As I'd said, we've had continued public health investment. One of these items is $11 million for Social Health Information Exchange, or SHIE. And we at CHI are really gratified to see this because we've been working on SHIE when it was just a funny acronym. So it's great to see such a vote of confidence from the governor's office in funding it to this level. If you're interested in learning more about it, just about anybody at CHI could tell you about it. I want to call out especially Ashley Brown, who's really spearheaded efforts for CHI and for Colorado in a lot of ways in this. And then finally, youth mental health funding. There are, again, a lot of different line items for this, but one to call out is $6 million more for the iMatter program, which gives any Colorado child the opportunity to have free behavioral health visits, mostly through telehealth. So the budget isn't the only policy, though. There's a lot that's not in the budget. Kendra is going to talk about that. I think AI really nailed the Colorado flag there, right? Yeah.
So unfortunately, we don't have much time to talk about the flag, but because there's so much that we have to talk about this session. We know that every session, the legislature takes on a ton of bills. Again, sorry for those of you who are already gearing up for session. I'm sure this is not a welcome reminder. But really the big topics that we're watching in the health space, which are a lot of really life or death important topics, can be characterized in one of two buckets: the unfinished business and the never finished business. And when I say unfinished business, I'm really referring to those bills that were sponsored by Democrats but didn't pass last session because of things like disagreements within the Democratic Party, funding constraints, or just lack of time at the end of session. And so I'm not going to go through all of those bills and topics, but there are two that I want to call out that I know are really serious, really life or death topics, where the Democratic Party hasn't really coalesced around a single solution or viewpoint. And the first is substance use. Overdose deaths are, of course, extremely high in this state. It is just a tragedy how high they are. And some of you may have heard of a string of overdose deaths among unhoused people last weekend, which is making me a little bit emotional, I'm sorry. But so there's a lot to be done to really try and lower the rates of overdose deaths. And there's been a lot of discussion about the best way to do that. And one proposal that's really gotten a lot of both criticism and support in the past year is overdose prevention centers. I know that some Democrats really like it, others, including Governor Polis, remain pretty skeptical about the idea. And I don't know if that specific proposal will be coming back, but substance use certainly will be next session. There was an interim committee headed actually by Representative DeGree Kennedy, who will be up here soon, that moved forward bills around treatment, recovery, harm reduction, and prevention. And then there was also a lot of discussion around the relationship between substance use and what the role the criminal justice system should really play there. And Representative Amable has actually also done a lot of thinking about that, spearheaded a separate interim committee this summer. And then another topic that we are really tracking on is assault weapons. An assault weapons ban came up last year in the Colorado House of Representatives and ended up dying in committee. But because of the really high rates of firearm violence, we know that firearm violence prevention, and assault weapons more specifically, are likely to be a topic of conversation in the upcoming session, both among legislators and advocates. And then to move to a slightly less contentious topic, we also know that the newest state agencies are likely to be a topic of conversation. The Department of Early Childhood and the Behavioral Health Administration have both been around for about a year and a half at this point, but they've taken a long time just to stand up because there are really major changes in Colorado government. And that means that fine-tuning takes a while, and legislative oversight is likely to be around for a while because of these major changes. Finally, in that unfinished business category, I wanted to call out affordable housing and housing stability. And this could be categorized as never finished business as well, I realize. But we really put it in this category because there were a lot of high-profile affordable housing bills that didn't get a lot of agreement last session that are probably likely to come back in some form or another this year. I will call out, in particular, land use and zoning is a really big priority for certain Democrats, and that's going probably to take up a lot of media attention and legislative time. But some other topics may include things like rent control and protections for renters. And then we're also likely to see some new conversations that we didn't actually see last year. And one that some of you may have read about in the news really focuses on construction defects and whether limiting liability for developers is a good way to incentivize developers to build more affordable housing. Now I'll switch back to that never finished business, which I mentioned early on. And I know there's a fine line between these two topics, but we're really categorizing in this area the topics that we're tracking on that end up being discussed every single session and often gain broad support that are really meant at chipping away at the issue without solving it. And as Joe actually already alluded to, healthcare workforce is always a top of mind concern and has been particularly top of mind since the COVID-19 pandemic. And so we know that more topics on healthcare workforce will be coming up and new bills will be emerging, including reimbursement rates for Medicaid providers and other healthcare professionals, as well as some other topics like licensing for healthcare professionals, loan repayment assistance, particularly for those in the behavioral health space, and then some conversation around healthcare worker safety. Healthcare costs are also a big priority. They have been a priority for as long as I've been following the legislature. And as I'm one of the younger people in the room, probably for a lot longer than that if you ask some other folks here. I know Joe, who has been following the legislature for a while, could talk about healthcare costs for days. But in recent years, we've really seen bills that focus on a wide range of topics, including alternative payment models and prescription drug affordability. I know many in the room are actually working on implementation of some of those proposals currently. But we expect to see other topics come up as well, including things like single-payer healthcare and studying how that could be implemented in Colorado, as well as discounted care programs in hospital settings. And then finally, in this never-finished business, climate, of course, remains a very prevalent concern for all of us. I know some folks just had a conversation about that in their last session. And so we saw interim committees this summer really talk about things like wildfire preparedness, water shortages and droughts, and air quality. And we know that those topics are likely to be topics of discussion this session as legislators really wrestle with the best ways both to mitigate the impacts of climate change and respond when there are acute climate disasters. And then finally, I did want to just give youth behavioral health its own call out. This is a perennial concern. This is a crisis, I think I could say at this point. For those of you in the last session, I know you've already heard this data, but 1 in 5 teenagers in Colorado actually struggles with their mental health in this state. And that's a number that's been rising for years instead of decreasing. And then many young people also report that they can't access behavioral health treatment when they need it, and that's particularly true when they're in crisis situations. And so given that, a lot of legislators have had a lot of conversations about what they should be doing. And this summer, we actually saw a pretty major proposal that was referred out of a committee vice-chaired by Senator Fields, talking about overhauling the behavioral health system of care for children and youth. That proposal could cost over $1 billion in future years. So this is pretty broad. On top of that, there were some smaller discussions about how to improve access to crisis services for children and youth. And then we also expect legislators to talk about suicide prevention this session, as well as social media and its impact on youth mental health. And again, some of you just talked about this, so you probably have a better idea of what that could look like than I do. But with that, I'm going to turn it over to Joe to close us out.
Thank you again, Kendra. All right, the 2024 election. You laugh, but can you bend your fingers like that? All right. We're calling the 2024 election unprecedented. The primaries haven't even started yet, but with the polling numbers looking like they are right now, it sure looks like we're headed for a rematch. And rematches are really uncommon at the presidential level in the US. You have to go back to 1956 to find the last one. This is the electoral map that put Joe Biden in the White House. And as he sits today, he is the oldest president ever to serve. And if Trump wins, he would be the second oldest to ever be president. So there's a lot of talk about how the age of the two major candidates is weighing on voters. I guess we'll see next year when it really comes time to vote whether this is a big deal or if it's just something to kind of occupy us and chat about while we wait for election year to roll around. A lot more important, though, is we have a major candidate who is under multiple state and federal indictments. We've never had that at the presidential level in the United States. He might even be on trial during the campaign. This is unprecedented. It's unpredictable. Nobody can say what kind of effect it's going to have other than it's putting tremendous stress on our institutions in our democracy. That includes the state legislature as one of our institutions. We can just expect this to be part of the background for the next year. Closer to home, we might have a very different House delegation by this time next year. First of all, 3 races to watch. Lauren Boebert on the Western Slope barely won in 2022. She will have another close race again this year. In fact, President Biden was just in her district a couple of days ago, calling her out by name. Second, Ken Buck is stepping down from his seat on the Eastern Plains. The race to watch here is probably the Republican primary. This is a conservative district, and we're already seeing some state legislators start to express interest in this seat. And finally, in the state's newest district, Yadira Caraveo also had a very close race in 2022, and I would expect Republicans to heavily target that seat in 2024. Last thing on the ballot to preview here is ballot initiatives. Again, it's still early, but we have some early hints of what might be on there, starting with abortion access. There will probably be a campaign to protect the right to abortion in the state constitution. Legislators put it into statute a couple of years ago, but it is, the Constitution offers a much more guaranteed, a much stronger guarantee of that right. Second, even though we just had a special session and another election about property taxes, you can expect that to be coming back. There are several initiatives in the works. And then finally, there was news last month about an election reform initiative that would do away with partisan primaries and set up ranked choice voting where you can vote for several candidates in the order that you prefer. The idea is to arrive at a winner who more voters could at least live with. So that's no shade on the elected officials in the room here, by the way. That's our presentation. Our takeaways, again, are it's a back to normal budget year. The years of easy money are done. Mental health and housing are going to be two big issues, especially youth mental health. And finally, bananas. So with that, Kendra and I thank you very much for your kind attention. We'll leave you with this picture of Coloradans walking on water, as we do. And then I'd like to invite up Sarah Schmidt for to introduce our legislative panel. Thank you so much.
Nice job, Joe. Great. Good job, Joe. Thanks.
Thank you.
Okay. Thanks, everybody. Thanks, Joe and Kendra, for an excellent presentation. Please help me welcome up some legislators to the stage. Senator Rhonda Fields. Representative Krista Greig-Kennedy. And we are so fortunate that Representative Kyle Brown is willing to step in at the last minute. Senator Smallwood was not able to join today, but fortunately, oh, and you are in the hot seat right here. Thank you. Representative Judy Amabile is going to be joining us virtually in just a couple of minutes. We need to do a little bit of a technology changeover, but have a seat, everybody, and thank you. So just want to give everybody a little run of show for the next 40 minutes or so. We will start with a couple of little lightning, we like to call them lightning round questions at CHI, just some quick things. Then we have a few questions that we'll all kind of talk through together, get some reactions from you. We want to leave lots of time, though, for audience questions. So write them down, get them going, and we'll pivot over to all of you, both our virtual audience and those who are in the room, to have some questions. Sound good? Okay. All of their bios are in the program, with the exception of Representative Brown. So what do you want what's one thing you want people to know about you?
Well, I think I've worked with about half of you, so
right?
You probably know me quite well, but I represent Louisville, Lafayette, Superior. I was appointed in a vacancy committee back in January of this year, served this and have served as a legislator since. And then, you know, healthcare affordability is really important to me. So I'm really pleased to be with you all, and thank you for allowing me to pinch hit on this panel.
Thank you for doing it. Okay, great. All right, well, let's start with a lightning round. So the first one is, what is the last great book you've read or podcast you've listened to? Or you could even tell us both. How about we start at the end with you, Representative Kennedy?
So let's see, let's first of all.
First, we'll get the mics to work.
There it is. Hidden button. So I wish I could say I read more often than I do, but I have a 2-year-old at home, and I find that any time that I'm not working is very focused on my family. A few years ago, I did, though, read a biography of Teddy Roosevelt, William Howard Taft, and kind of a discussion of the golden age of journalism called The Bully Pulpit by Doris Kearns Goodwin. There was a really insightful look at the way the politicians and the media can kind of interact either for good or for evil in some cases. So I think that's worth reading.
Thank you. Senator Fields. You.
Good afternoon. State Senator Rhonda Fields, representing Senate District 28, which is in Arapahoe County, and it also serves a portion of Adams County. I'm a member of a book club.
Nice.
And I've been a member of a book club for over, I would say, 15 years. And it's a small group of African-American women. And we study a book. Sometimes the book is one book per month, or sometimes it's a study book. And right now we're studying or reading the 1916 Project by, you probably know who she is, Hannah Jones is the author. And so it's a book about slavery. The first slave ship that came to America before Mayflower. And it just talks about slavery and the hardship and the oppression of slavery. And it makes me feel really privileged because I have privileges and opportunities that my ancestors didn't have. So I would encourage you to read 1916 Project.
Thank you.
All right, so I'm clearly not the most serious person up here. I'm sorry, it's hard to follow because what I was going to say was Dune, and my podcast was going to be wait, don't tell me. So sorry for that.
That's
so
okay.
That's my answer.
Takes it all. And it sounds like we are able to have Representative Amabile on the screen. So oh, and look at that. There she is. Can you hear us? Oh, we can't hear her quite yet. I'm looking at people who know. Okay, well, we'll do one more. Representative, we're trying to just fix the volume so we can hear you. Are you willing to disclose? Do any of you use artificial intelligence? Does anybody have ChatGPT? And I see lots of...
I do not, but in preparation, I did go online to learn more about it and try to enter some questions about where should I go for vacation.
Oh, what did it tell you?
It gave me a lot of different options, but I think I'll use it. I think it could be a time saver. Mm-hmm. And for me, and it's a new tool that's out there, I think I'm going to use it.
Okay. No.
I've never been an early adopter of new technology exactly, so I've steered clear of it on purpose, and after this morning's presentations, I'm going to keep that up.
Okay, all right. No.
No, I don't even know how to use ChatGPT, or I'm sure my children, who are much younger than I am, obviously, could probably do it. No, quite easily, but I'm not able to do that. So.
Okay. Let's see, Representative Amabile, can you hear us now? And more importantly, can we hear you?
Okay, I can totally.
Yeah, we hear you. Okay.
Okay, great.
Thanks for joining us.
Let me just say first, I haven't read a book in like 3 years. I'm a little bit embarrassed about that, but I'm not even sure I know how to read anymore, and unless it's a bill. And second, I don't know how to use AI either. I'm barely even able to use regular I.
Just telling it like it is. Thank you. All right. Well, before we get into I'm curious, do any of you have anything stand out to you from Joe and Kendra's presentation just a couple of minutes ago about kind of looking back at the 23 elections and looking ahead to the next session? Anything stand out that you wanted to comment on or respond to? And anyone in any order?
I mean, there was a lot that came up that fueled thoughts, and I'm hesitating because I could go off on property taxes or on the electoral stuff, which is not really the core focus of what this group is about. But I would say the continuing efforts to expand behavioral health and substance use disorder workforce in Colorado and build out a system where people have real access is a real challenge. And it's been something that we've been chipping away at over time. Yeah. But it feels like you never solve the problem. It feels like you've got your foot on the gas as much as you can, and yet you still hear these horrible stories all the time about people who can't get access to care, even if they've got good insurance, or even if they are enrolled with Medicaid and have a patient-centered medical home, and I think that there's so much work to do there that we're going to be talking about this for decades.
Okay. Yeah. Thank you.
And I would just like to add, I thought it was a very good introduction for the folks here in reference to the makeup of the House and the Senate and some of our accomplishments. And I would say the unfinished business I would have identified the same things, especially as it relates to behavioral health. I voted for that. We still are working to try to cobble that together. Mm-hmm. The concept is wonderful. The mission statement is so that anyone can have access to behavioral health no matter where you live across the state. And it should be like not a revolving door. You go in, you get referred to the services you need, and you're not caught up in this kind of cycle of not getting the treatment that you need. But we haven't gotten there yet.
Thanks. Representative Brown?
Yeah, I was going to add that I think that the focus on sort of health, what I'll call health-related social needs or social determinants of health will continue. And I think that the land use conversation, the housing conversations that we're having are ultimately, at the end of the day, healthcare conversations. I thought the statistics this morning from the CHAZ about, you know, the health of people who are stably housed versus those who are not. You know, this is something that my community is dealing with in the wake of the Marshall Fire. You know, people have lost their homes and have been struggling to find affordable places where they can continue to live in our community. We are going to continue to grapple with these health-related social needs, whether they're nutrition or housing. And I think that was an important insight during the presentation.
Great. And I want to go back to that in just a sec, but I first want to see if we want to spotlight Representative Amabile again to see if she has anything she wanted to respond to from the presentation just a minute ago.
Yeah, so I think for me, obviously, and the reason I'm here is we have to work on behavioral health. And to Senator Field's point, it can't be a revolving door, but it is right now. And every week at least, and today like 3 times, people reach out to me and say, hey, we're in trouble. Our family's in trouble. Who should I call? And I have nothing to give them. I don't have an answer for them. And that should not be the case. Every person should be able to get help when they need it. Just like if you were having a heart attack, you would know what to do. So I think that's a huge gap that has to be addressed.
Okay, thank you. Okay, we'll get back to that one too, but Representative Brown, you talked about the framing and these connections between housing, health, economic security. Curious, these were certainly topics from the special session that just happened. How widely talked about is this framing and this recognition of this connection, this intersectionality between these different topics and the relationship they have with each other? Was a part of the discussion during the special session? Do you think that that's starting to come online a bit more and recognizing it? And are we getting closer to making some of that interconnected change with some bills?
Yeah, thank you for the question. First of all, and I think it is, I think we're moving in the right direction on those conversations. I know that as long as I've worked, just about as long as I've worked in healthcare, we've been talking about social determinants of health. But I think it's a game changer when we have the federal government now putting Medicaid money on the table for health-related social needs. It's changing the conversation not only here in Colorado, but nationally. I hope to continue to work on this and to continue to move us in that direction and hope to bring some of those federal resources to bear for things like housing. I do think that my colleagues, right, the ones sitting here, as well as others, know that, you know, folks who are better fed and better housed are also healthier. And I think it's finally, you know, when we invest in things like EITC or summer EBT or any of the number of programs that we've invested in, or rental assistance like from the special session, these are the programs that are helping to not only keep people housed and fed, but help to make them healthier as well.
Thank you. Senator, Representative.
I am extremely proud of the work that we did in the special session. Now, I have some battle wounds from it. It was hard for us to get everything done across the finish line, but the governor was really clear about what he wants us to accomplish in his executive order. And I'm pleased to say that we delivered for the people of Colorado. And the way we delivered that is that we ensured that the table refunds would go to folks. We ensured that we would maintain the summer nutrition program where we're feeding kids. We also ensured that there would be a tax-exempt child tax credit going to folks. We did the waiver assistance for rental assistance, housing assistance, and there was 5 bills. I think I'll let you talk about the ones I missed. But we did everything we were asked to do in that executive order and probably more. But all of it was designed to make a life more affordable for the people of Colorado. And so I'm really pleased, even though it was painful, we still got the work done.
Yeah, the Monday, the fourth day of the special session was my 44th birthday, and it was the worst birthday I've ever had. Fortunately, I got a few days off after that for Thanksgiving break, and that made it a lot better. You know, I actually do think that there's a broader recognition of health-related social needs. You know, when I first learned about it, when I came into the legislature, it didn't feel like it was being talked about a lot. And now I do think that you ask people about just in time for us to change the term from social determinants to health-related social needs, everyone's caught on, and now they have to learn a new term. That said, I do think there is a broader recognition. I think people see it. That said, I don't think it was very explicit during the special session. And this happened for a variety of reasons. I mean, housing security, food security, general low-income economic security, those things stand alone and don't always have to be connected to health to be justified as a policy. And so I think that is really, the focus was mostly on the economic piece. But a lot of people had in the backs of their minds, this could impact people's health down the line. Unfortunately, everything we did in the special session, almost everything, was just for 1 year, right? This was kind of a put dollars in pockets next spring, see what we can do. I'm also incredibly proud of how we apportion those dollars and really prioritize the people that are most likely to be struggling, because it is fair to say that too many of the dollars in Proposition HH went to the wealthiest and to the largest corporations who did not need those kinds of savings. And so in the special session, we focused those resources where they were most needed, and I believe it's going to be meaningful in terms of hundreds, if not thousands of dollars in families' pockets next spring. But the work will absolutely continue.
Right. Thank you. And let's see if we can spotlight Representative Amabile.
Okay, thanks. Yeah, I mean, I don't have a whole lot to add. I think we did a great job of a balancing of interests, of making sure that everybody got some relief and that the people who need the most got the most. But it's a 1 year thing. We did a 1 year fix, a Band-Aid, and there's so much more to do. And I know that everybody in this room understands that, and that's what we have to work on when we get back in January.
Thank you. Okay, just a couple more questions up here, then we'll open it up to all of you, so be thinking about your questions. Let's talk about behavioral health. Thank you for bringing it up, Representative Kennedy, and just at the beginning. It's top of mind for all of us as professionals, as people, as family members and partners and parents and neighbors. And we're not headed in the direction where we want to be going. And you all as legislators and everyone in this room as advocates and providers and policymakers in your own right in your communities have been working on it very hard as well too. What's left to do? What do we need to do differently?
Thanks. So much. Yeah, I think that, you know, the presentation that Joe and Kendra put on earlier, and they kind of rattled off these bits and pieces, and you know, with things where we only meet 4 months a year and we don't. A lot of people go work other jobs the rest of the year. And then we have term limits on top of that. It is pretty hard for us to build comprehensive systems. So I would say that there's progress being made. There are initiatives that the governor's office has continued from the previous governor's administration where there is progress. And when I hear things about the social information exchange, I think that's critical infrastructure that will be key to what we do in the future. But I think that we do need to just keep on working on the fragmentation problem. We don't have a system. We have lots of different little access points, but this one you may not be able to pay for, or this one you may not be able to get an appointment for. And there's so many deep, deep problems. And I would say an awful lot of it comes from the way that we pay for healthcare, where you've either got, okay, honestly, if you're on Medicaid, you're one of the lucky ones now because that is the closest thing to a comprehensive system. But even there are tremendous provider shortages because we don't pay the providers enough. And so I hope this isn't too doom and gloom, but this is kind of all of our life's work. We are all going to be working on this for the rest of our lives because it is that big of a challenge that we need to build solutions toward. I think I want to just add one more specific thing, because my real focus in this space has been on substance use disorders. I was the chair of the Opioid and Other Substance Use Disorders Interim Committee this summer. I've served on that committee in 3 other summers under the leadership of other legislators who came before me. And I think there is progress being made. We are working on getting rid of insurance barriers that make it harder, looking for new ways to create pathways to becoming licensed as an addiction counselor. And so there are things we can do there, but even these big, huge bills, they cost millions of dollars, are just one tiny piece of a much larger puzzle that we just have to keep working on.
Yeah, thank you for that response, because I feel the same way. We have all these ideas, but they seem to be independent, siloed, and patched. It's not coordinated, it's not in harmony, and it's causing a lot of confusion in the community. And the community I serve, for us, it's about access. I represent East Colfax. And so all up and down Colfax, when even I go to work, I mean, I can kind of see the people who are struggling with some type of behavioral health issue. Sometimes it could be a substance abuse. But it's a high number. I'm worried about our kids. I'm really worried about their behavioral health, especially since post-COVID. We had some young people here who were very articulate, but I didn't get a chance to really ask them, how are you? And when I'm saying that, it's really like, really, how are you? Because we see the social, and I brought my phone, I hope you saw it, but you see the social media interaction, and then I'm wondering how they're interacting personally. If you're so involved with 16 hours or whatever hours it is with social media, what are your social skills like? And how are you processing COVID coming back when you know someone in your family passed away? I mean, there's a lot, and then you're expected to just be normal after what you've just experienced. I don't have the answer either, but if I could have, my solution is all about access, and access means getting people the treatment where they are. And, you know, we need outreach. I need folks out there on Colfax. I need people on some of these corners. I need folks to have access to health care. You might have, you know, your food stamps or your card to get food, but what if you don't really have a kitchen and you can't buy hot food? I mean, there's a lot of other things that we can do to address hunger and housing and behavioral health, and all of those kinds of things come together, and it's all kind of tied to wages, because a lot of people are just like $400 or $600 from falling off the cliff. And then they find themselves in these circumstances that make it hard to get back. So we need to have a better and stronger safety net.
I appreciate all those comments. I think that the access issue, Senator, that you were talking about is really exacerbated by the way that we pay for health care, which is what Rep. DeGree Kennedy was talking about. In particular, in behavioral health, I think it's a problem because, you know, most of our, or a lot of our behavioral health providers do not take insurance in the way that your hospital does or your primary care doctor does, right? In some ways, it's much easier and it is doable to be a behavioral health provider and to not take insurance, to take cash, or to be insurance friendly and give your client a statement of how much. We don't pay enough, I would argue, in the behavioral health space to make it worth a lot of providers' while. You know, it's much easier to treat the worried well than to work as a psychiatrist and trying to treat the most severely mentally ill. And that's a function of the way that we pay for health care, the prices that we pay for the types of services that we're talking about. And until we kind of get behavioral health fully integrated and we pay for it like we value it, we're going to continue to struggle to provide appropriate access.
Thank you. Representative Amabile.
Yeah, thank you. So I guess what I would add is what I think we need to do is create a system, a continuum of care that prioritizes the people who are the sickest of the sick in both mental and behavioral health. And we are doing the opposite of that right now. We have a system that prioritizes the people who have the least serious illness, and we are ignoring or vastly underserving the people who have the most serious illness. And we don't do that with any other disease. If you're in a diabetic coma, you get rushed to the hospital and they take care of you. And then when they release you, they tell you what to do and they give you the medications you need and they follow you for the rest of your life. When you have a serious mental illness, you cannot get care. You are literally shut out of your community mental health center. You are barred from going to various facilities if you've ever had any violent behavior that follows you around and people won't see you because of it. And we need a public system that creates a continuum of care that serves the people who are the sickest. Because if we do that, if we create that, then everybody else will have a place where they can plug into that system. And it does cost a lot, but we're already spending the money. We are just spending it on jail, on prison, on homelessness, and on this lack of participation of a whole section of our people who aren't able to participate in the economy, who can't get jobs because they aren't getting the care they need. And I think that starts with building more beds, hospital beds, residential care, transitional step-down, group homes, sober living homes, supportive housing. And we need all of that. We need more of it than we have right now. And we need everybody to join in making sure that we work on that and that we prioritize that.
And let's keep Representative Amabile up, actually. There she is. I'm going to turn this last question into a lightning round so that we can get to our audience questions. Representative Amabile, is there a health-related bill from the past few years that you feel hasn't gotten the attention it deserved?
Well, I don't know about attention. I think the one thing we did was we put some money into building some beds, and they're residential step-down transitional beds. And they're just starting to come online right now. And I had to fight like a wild tiger to get them to put this into the ARPA money funding, because nobody wanted to do it because there would be ongoing costs associated with these beds. And they are just starting to come online. And now I'm hearing, in all of these conversations we're having about the competency backlog and the how many people are stacked up in jail and the wait list to get into the state hospital. We need more transitional beds. Okay. And so I wish I could have gotten more people to believe in that at the time when we had all that ARPA funding, but we have what we have. We need more of that, though. And so, that's the one thing that pops in my head if I had to identify one thing.
Thank you. Representative Brown.
Thank you. Yeah, I'm going to take I'm going to say that there's a bunch of bills actually from as many as 13 years ago that has set us up and has given us a good, we are a leader in many ways in healthcare in America. Colorado is leading the way on many of the most kind of innovative policies in terms of providing healthcare. And I think that a lot of that started more than a decade ago with a strong bill that created the APCD and future legislation that created additional transparency that helped to give us the tools and the understanding of what's going on or what was going on and what is going on in our healthcare system that then allow us to create important policies. So some of the work, I'm going to give Degree Kennedy a shout out here, because some of the work that he has done in creating additional transparency in terms of prices has really moved our affordability work in Colorado a long way, in addition to many of the other work that he's done on quality and value. You know, the folks on this stage, obviously Rep. Amabile and her work in behavioral health, and Senator Fields on access to care, you know, it goes without saying. But I just want to say that some of the work that the studies, the transparency bills that we have done over the last decade have set us up to be a leader, I would say, in America in terms of innovative government policy.
In the one bill I can think of, it was when I was elected in 2010, and my very first bill in 2011 was with Representative Tom Massey. Was it Massey or Massey? Massey. And it was a bill to address obesity in childhood. And so the thought in the bill, and it passed, and the governor did sign it, it was to require 30 minutes of physical activity in elementary school, and they're not doing it. So sometimes when we pass legislation, it's not fully implemented. And when I explore it, you know, it's like we need to have a PE teacher to do that. Well, you know, really, just stretch, go out and play. I mean, it's doable, and that was the requirement in the bill. But it wasn't really successfully implemented across the state to require every school child. That was my goal, to have 30 minutes of physical activity in the school day. Yeah. And we're still not there. They're still sitting stuck in their seats, and we still have a high rate of obesity in our kids.
So I've gotten really interested in primary care access over the last several years. And, you know, one of the things that has been a talking point and a goal that has been talked about in all the big healthcare conversations is if you make these early investments in preventive care, you're able to head off the longer term costs of a variety of different types of more expensive care, including emergency care. And yet it seems like we're not actually making that much progress in that direction. There was a bill in 2019 that created the Primary Care Payment Reform Collaborative. I see Tara Smith back there. She runs it under the Division of Insurance. And this has been a group that has convened a variety of stakeholders who are invested in the future of primary care and has given authority to the Division of Insurance to promulgate rules, including increasing the minimum spending on primary care. And so there's a regulation out there requiring a 1% increase in primary care spending. There may be some more details I'm forgetting there, but also tries to channel those dollars into advanced payment methodologies and other ways of increasing the value of primary care outcomes. Because I continue to believe that we need to reinforce that every patient deserves a medical home, a central hub, a doctor-patient relationship, and a way that the relationship with their doctor helps fuel their health and the connections they make to other providers. So I think that bill was very significant, and the work that is coming from that collaborative is ongoing.
Great, thank you. Okay, who's got, oh, we've got, yep, hands up all over the place. So I can't see that side of the room very well, so I'm gonna trust someone's gonna get a mic and ask a question, then we'll come to this side, then we'll come back to that side, so.
I think we're gonna start over here.
Okay.
If I could get help with the mic. Okay, there, I think it's on. We'll start with you.
Thanks so much. Good afternoon. Can you hear me okay? Wonderful. Since we are talking about that gap in coverage and that specifically we have a need for healthcare that is both integrative as well as synthesizing, I would just like to address what your guys' opinions are, or if it's even something that's been considered, looking at expanding coverage to naturopathic doctors. Currently, I understand that there's approximately 86, maybe 90 that are associated with the Colorado Association of Naturopathic Doctors, and there are more throughout the entire state that are associated with the American Association of Naturopathic Physicians. Currently, there is federal legislation that is being put on the docket to try and expand the Social Security term of physicians to expand to naturopathic doctors. But considering that there are efforts and boots on the ground being done here, I'm kind of curious if that's something that we've explored or if it's even crossed your mind.
Right. And maybe I'd ask if one of you wants to respond, just so we can get to more questions. So, and Representative Amabile, raise your hand if you want to be the one. Oh, yes. Okay. You get to answer this first question.
Okay, I mean, I had occasion recently to meet with a bunch of the naturopathic doctors in Boulder, and Rep. Brown was there too. And I feel like that is really a resource that we should lean into, and that it's absolutely important for us to allow naturopathic doctors to perform at the, at the boundaries of their scope. They should be able to do all of the things that they're trained to do. And there is a very important role for them to play in our healthcare system, both in mental and behavioral health and in physical health and well-being.
Great, thank you. Okay, we'll take a question here. I think they're coming, and then we'll go maybe virtual and then back into the room.
Yeah, my name is Ray, and I just had a question. You found me? I'm sorry, I was sitting down. So my question is, despite, just working on things that are just the symptoms of a lot of this mental health issues, housing issues, and things like that, like prisons and the effects of all these things going on in our city and our state and our country, really, what is our legislators doing to provide the community-based organizations with more resources and de-siloing a lot of these systems in order for us to be more effective in community engagement and providing, help from within our communities to our own community members?
Just one of you want to take?
Thank you, sir. Try that one. Very good. Great question. And I think that we all do this when we look at bills that we are trying to pass forward. We always look for expanding access for all people. Or we're looking at how is that going to have a negative impact for certain demographics. But those are the kinds of things that we look at when we read and evaluate a bill. And personally, what I try to do is to make sure that we're increasing access that reaches all of Colorado, and making sure that we're not having a negative impact on some communities because of the way the bill is languaged, it's going to exclude someone. And so when I say access, I'm talking about rural, I'm talking about urban, I'm talking about suburban, I'm talking about economics, I'm talking about racial demographics. It could be based on income. But we try to be very diverse in making sure that we're not creating more harm, because government is really, really big, and it's very complicated, and there's a lot of red tape. So I know personally I look at ways to cut red tape and redundancy, and making sure that people can get access to resources quickly. Because a lot of folks just don't have that kind of time to kind of handle some of the barriers that we create. So I think as lawmakers, we're constantly looking for better ways to make it easier to get access to resources, even if it's grant funding. The state has done a marvelous job getting technical assistance for grant writing, making sure that we're just more accessible to people. Because if you don't, then things fall apart, people do desperate things, and it creates more government when we find that people can't have their resources, or they get health issues, challenges, but that's how I would answer. I think that we look for opportunities to expand access.
And I might just briefly add to that, a pretty healthy amount of the work that we've done over the last few years has been creating grant programs that fund community-based organizations. So particularly when we had the federal ARPA dollars, there were several different grant programs, largely for housing or behavioral health. Those were our two biggest focus areas that came out of that, but a lot of grants going to local governments, and as Senator Fields mentioned, the grant writing assistance programs that have tried to help the smaller organizations that maybe don't have capacity to apply for a lot of grants to take advantage. That's something that we're renewing in the substance use space. And lastly, I'll just add that local governments are starting to get opioid settlement dollars, and a lot of those dollars are also going to be going out to community-based organizations.
Great, thank you. Do we have any questions from the virtual audience? Looks like we're bringing the mic over so that we can ask on behalf.
Hello. Okay, we have a virtual participant, Sarah, who can't come off mute but wants to know if she could get tips from Senator Fields or anyone else on the panel about what advocates should do if a bill isn't being implemented fully.
Oh. So the question was, any tips or recommendations to advocates, to anyone really in the community who feels that a bill is not being implemented fully? You referenced the physical activity bill.
Let us know.
Okay.
You know, because we really like passing bills. I think I saw 820, I thought it was 630, whatever the number was. We like passing bills. And it's hard to kind of keep up with if it was implemented. The one that comes to mind right away is like, not right away, but the red flag law. You know, we had sheriffs decide, well, we don't like it. So we have some people and agencies that really don't like our bills, and they can slow things down, and we're into passing another bill. So I would say if you see something that's not working, and it happens a lot, this is where the voice of citizen and the voice of residents makes the difference. Because if it's not working, it's because someone's not implementing it. Maybe it's because they don't have the resources to get it done. There might be a good reason for it, but we don't realize it until someone tells us. Because I really trusted the organizations and our administration and the people who are a part of the government that we saw with all that money goes through. They're supposed to be implementing those ideas, but they get bogged down. Mm-hmm. And so you have to let someone know, and all of our information is public. It's on our website, Colorado General Assembly. Access your city council member, school board member, your elected officials, congressional. Let everyone that you know that needs to know what's working and what's not working, because I think that we're all in this line of work to do good work.
Thank you. Okay, maybe we can get to two more questions, maybe one from this side of the room and then one from the other side. I can't see who has the mic, so I'm just trusting.
That's all right, Sarah. I'm passing it over one more time. Here's our second question from this side of the room.
Thank you all so much for being here. Appreciate your leadership. My name is Maisha Fields. I'm a nurse practitioner, and I work for Salud Family Health Centers. I'd like to know, how are you guys grappling with the fact of low enrollment or disenrollment for Medicaid, and the crunch of community health centers and federally qualified health centers having to close shop post the ARPA funding? And what are your plans to make sure that we can retain nurses, doctors, behavioral health care providers, to make sure that we're not closing the safety net clinics across our state post-COVID and ARPA dollar funding?
So I'll go ahead and take that one. I really appreciate the question. I think what I saw in the CHAS data this morning is that clearly the Medicaid lock-in, for better words, for during the PHE was successful. It kept people in coverage. It has increased our coverage rates. And now what we are grappling with is going back to a point, business as usual or business pre-pandemic, and folks are losing their coverage. And that's not good for anybody, as far as I'm concerned. So we as legislators, I'm going to be taking lessons from the presentation this morning that Jeff gave, to think about how can we learn the lessons of the pandemic and continue them forward, because driving that coverage rate, or driving our coverage rates up and our uninsured rates down is a key part of making sure that community health centers can keep their doors open and that doctors can continue to practice.
Thank you.
Seems like an opportunity to talk about Tabor. When I'm not working on healthcare policy, I'm working on a lot of fiscal policy. And And I think that, the ARPA cliffs are a real challenge. I know that the folks over at Healthcare Policy and Finance are doing everything they can to plan ahead and build those longer term plans, but there comes a point in time where there are not enough state dollars. And just to paint a little bit of a picture of this for everyone, the state income tax right now is at the lowest point in the history of Colorado. It was a graduated income tax up until the late 80s, then it was turned into a flat income tax at 5%. It's been lowered several times, including twice in the last few years by votes of the people of Colorado, and is now at 4.4%. That's the bulk of the general fund of the state. Even at that historically low income tax rate, we have collected $3.2 billion above the Tabor limit this year. These are dollars that we are required to refund to taxpayers. We're attempting to do that in the most equitable way possible by putting those dollars in the pockets of people who need help the most, rather than the highest income earners, which is the way it would have defaulted to. But think about what we could do with $3.2 billion. We could more than fully fund K-12 and higher ed in this state, which I just have to mention those because those are always on the conversation here. But think about what that would mean for Medicaid providers. Think about if we were not paying Medicaid providers 80% of the Medicaid reimbursement rate, and we're paying them at least parity with what sorry, I think I said Medicaid twice, Medicare. If we were paying them the same as what the Medicare reimbursement was, or even more, because frankly, I'm looking at my friends with the Hospital Association here, I know that even the Medicare reimbursement is not adequate to cover the high cost of care in Colorado. Think about what we could be doing with those dollars to pay providers more, to make investments in healthcare infrastructure in Colorado, and to sustain these investments after the federal funding goes away. So I don't have a magic solution for that one yet, but believe me, I'm working on it.
Okay, thank you. Okay, we have, can we get a quick question on this side? Whoever has, we've got a hand up right there. Take us home.
Thanks. I'm Catherine Mullardy with the Hospital Association. Appreciate the comments. And actually, I think you, in some part, answered my question, which is why I was hesitating. But I really appreciate the focus on behavioral health for this panel today, and thank all of you individually for all of your work in that area. Certainly the consensus around the need for additional beds and additional providers and increased provider rates, I think, is a consensus concept that we can all wrap our minds around in this room at least. But we also know that ARPA funds are really holding up the BHA right now. And while I appreciate your work on Tabor and long-term funding solutions, the cliff is visible on the horizon. And so I was just hoping you could talk a little bit about kind of what some of the plans are. I was intrigued a couple weeks ago when I saw that Governor Newsom in California just announced a huge investment. It's actually a tax increase request in California of about $6 billion to create 11,000 new beds. Some parts of that are controversial, but is that the answer? Do we need increased revenue to make behavioral health, meaningful behavioral health reform, a sustainable reality? Thank you.
And I might see if Representative Amabile, do you want to respond to that question? Just, we haven't gone back to you in a minute, so.
Yeah, I would. So do we need more money to make good behavioral health care a reality? Yes. What can we do here in Colorado about that? Well, we can't keep the Tabor money, and you're right, this cliff is happening. And so I have been interested in looking at potential ballot measures that would ask the voters, do you want to pay for mental and behavioral health services, and do you want to direct that money to people of all ages, from all over the state, from all walks of life, who have the most serious illness? And do you want to help with your tax dollars to create this continuum of care that we desperately need? And I think there's appetite out there for it, especially if we find the right thing to tax. And there was some polling that was done this interim about various ways of doing that. And I don't think we've hit on the solution just yet, but I am very much interested in asking people, because it is a public safety issue. It is a human interest issue. It is about making sure that we are doing right by the most people. And it's worth paying for. And again, it does save money in the long run. And I think we can really make that case, and we can make the case that we will have less people in our jails and prisons. Our prison budget just went up over $1 billion. And I was on a call yesterday. They're going to be asking for another 500 beds in our prison system. And those people that are in prison, 50% of them have a diagnosed mental illness. And we really could be doing this in a better way if we could get upstream and give people the care that they need.
Thank you.
I know that's not a whole answer to your question, but.
No. All right. Well, please join me in thanking our panelists. Thank you. And thank you for joining us virtually, Representative. Okay, you could stay or you could go down, whatever. We're just about done here. So I am all that stands between you and the reception. So I am going to try to be brief. Let's see. Okay. Well, they'll do a little few things. Okay, so now we're wrapping things up here. So if you still have a raffle ticket in your possession and you haven't put it into the raffle drawing, brilliant CHIers are walking through the aisles right now with buckets. So be sure to pass your raffle ticket down to the front so that we can have that. I'm really grateful for all of you who have been hanging out for the full day. I feel like we have covered a lot of territory. We start with understanding what's going on in trends in health and well-being in Colorado with the 2023 CHAZ. Then we kind of think a little bigger and a little differently with our discussions around AI. Then you all were in many different sessions earlier in the afternoon to really get into some more detail on things like the connection between climate and health and how your work impacts it, or how we can transform our systems, break down silos, and put people in the center so that we have people first transformed care using things like journey maps. And then in here we had a youth panel really talking about what they think about social media and what they would like to see happen in terms of social media and the relationship with their mental health. I wrote down one of these quotes. So there was a question about, like, would we ban social media or create some really rigid barriers around accessing it? And one of the youth said, "The youth will resist if that is what happens." I had to write it down. It was so funny. Okay, so last chance on that, on the raffle. Looks like we're good on that. While we are stirring things up, please help me continue. Well, we want to know what you think. Please, they're on the table in front of you are QR codes. Please be sure to fill out the evaluation. As a health policy research organization, we really care about data, and we really want to understand what you think about the conference, how we can improve it, what you want us to be bringing to this stage in these discussions, and how this can be of greater value to you in the work you're trying to do. So please do fill out the evaluation. Please also just thank you to our sponsors, Rocky Mountain Health Plans, a United Healthcare company, the Colorado Health Foundation, Colorado Access. Oh, there we go. Our reception sponsors, who we will be thanking in person very soon, the Colorado Hospital Association, Trailhead Institute, and Partners for Children's Mental Health. Our scholarship sponsors, Craig Hospital, Colorado Community Health Alliance, and Intermountain Health, Caring for Colorado for our lactation room, Connect for Health Colorado for wireless. Did I get everybody? I think I did. And then we also gave a prize away earlier today for registration through Green Spaces. One of the prize winners, her name was Lupita Garcia, and so she won the Green Space prize. Before we get to the raffle drawing, which is the last thing we'll do, I just want to give a thank you first to all of you for being here, and really for your support of CHI over the last 18 months. We've been in a time of transition, are coming into a new phase. So thank you, all of you, for that support. I also really want to thank the team who has made all of this happen. Thank you. Yep. Big round of applause. So our communications team is second to none, and they have been running behind the scenes all day, including coming up on the stage, handling things that we couldn't. Christy your work. And then lastly, just want to thank the Hot Issues Project team, Mia Balifa, Nina Bastian, and Trenton Garber for their work. Like, they kind of keep all the trains going. So thank you to the three of you as well. Okay, now, the most fun is the drawing. Thank you, Emily. Oh, okay. Oh, well, so we do actually, I lied. We didn't give away the green space, the green spaces giveaway. So we're gonna raffle two things off. You do have to be here. So for 12 months of what Green Spaces is calling their Jungle Club co-working membership, Green Spaces is a co-working space in Denver. So I do think it probably is best for someone in the metro area, but we're gonna hope. Okay, so this is for the Green Space. Lucia Sanders from Civic. All right, come on up. Nice. Yeah, I don't have anything to give you besides a high five. Right on. All right, and then our last, so we used to give away a bike. One of CHI's founding members and board members, Dr. Art Davidson, he's a primary care doctor at Denver Health, kind of the architect of health information exchange and public health informatics. He rides his bike everywhere. He's kind of my personal hero. We used to give away a bike. Then we decided a few years ago, like, some people maybe just don't want a bike. They might want a gift card instead. So we are giving away a REI gift card to Lindsay Edwards. Are you here? Yeah, come on up. All right. No, you go for it, Kimberly. Okay. Congratulations. Okay. All right. Well, please do join us for the reception. It is literally just across the way, so you don't have far to go. Thank you. Thank you for making the 2023 Hot Issues in Health what it is. Appreciate all of you.